Collaboration is the only word.
Oh, no. You want all three?
Yeah.
Learning and commitment.
Learning and? Commitment. You want to commit to something, or somebody should commit to you, or?
I want to commit to the greater kind of European push for partnership between industry and big science.
Excellent. You are looking for collaboration with what type of partner? Because maybe we can find them already now.
Well, we already have some partnerships in the room. My company deals a lot in material science.
Yeah. Sustainability. Okay, if you want to collaborate with somebody in material science and sustainability, this is your guy. Let's see, who else has a word for me? Lady in the blouse with a pattern. Would you like to share? Inspiration, new knowledge, and the third word? You have, but that's good enough. Thank you very much. Any third volunteer? Pia Kinhult? Sharing experiences. Excellent. So we all, is there anybody else who's bursting, wanting to? I see Alexander is bursting from Chalmers.
Let's say the discovery and innovation to see, because we're here for the life science area, and see what are the pressing issues where transforming ESS really can bring things forward.
Excellent. So this is the type of format for this day. I want you to feel able to share thoughts, ideas, argue with the panels, or come with your own input all along the way. Now it's time for our hosts, because all of this is possible because of Vetenskapsrådet and Vinnova, and we have the two director generals here. I welcome you up on the stage. Darja Isaksson and Katarina Bjelke. I think Katarina is first.
Thank you. So, thank you very much, and most welcome from the Swedish Research Council. I can start by saying that.
And a warm welcome from Vinnova.
Yeah. So, I'm really, really happy to see so many people here today and joining this actually 5th ESS MAX IV Summit. We've had this event in Uppsala, in Stockholm, and in Luleå, and two of them actually, that was only 3, 2 of them actually were digital because of COVID, of course. And now we are here in Mölndal, and we really appreciate to be in this environment, I must say. It's fantastic. It is the West Coast hub of life science and MedTech. And I would like to direct a special thank to Zlatko and his team at the Mölnlycke Healthcare. Actually, this is the first time I just heard that we are here in this building, and so it's a kind of inauguration, actually, unofficially. So we are grateful for that. And today we are going to focus on life science and MedTech. Those are areas where Sweden have high ambitions and where we see that these fantastic facilities can and will help to solve a lot of societal challenges in the future. And that is what we're going to discuss and try to find new ways of collaborating today. Maria mentioned the Draghi report, and that is kind of a wake-up call, I must say, to Europe. And if you read the report, you can also see that there are big discrepancies between the north and the south of Europe. And it would be preferable if the southern parts would move a little bit to the way we are working in the northern countries, because we are quite actually good at collaboration and we are good at innovation and research. Of course, we must and can always be better and act faster maybe, but not losing the long-term perspective, which we are very good at, I would say, in in this part of the world. And yesterday, I think that many of you saw that the report or the evaluation of the midterm Horizon Europe report came. It's called Align, Act and Accelerate. And they try to speak about what is needed in Europe in the future, and what is needed to strengthen the European competitiveness in the long run. They come with 12 recommendations, and 3 of them I must highlight a little bit. It's a focus on long-term investment in world-class facilities. Very important. Better coordination in EU, both funding and investments, of course, and collaboration in different ways. And also enhanced collaboration between research and technological infrastructure. So I think that these reports will actually be a wake-up call, and I think and I know that many people are looking at the reports right now and trying to make plans in how to enhance the competitiveness of Europe in many different ways. These reports also, as a funding body, you also look at what do they say about the funding landscape, and what they actually lift is that we need to be more innovative also in the way we fund research and innovation. We need to experiment maybe a little bit more than we have done so far, and still keep, of course, focus on high quality, because that is what counts in the end. So I think with that said, we are waiting in Sweden for the Swedish Innovation Research and Innovation Bill. And what we know so far is that there will be quite a lot of money, actually. 6.5 billion is what they said by the end of year 2028. If that will be enough, we'll see. But we also heard a little bit about what is in the text and what they want to put their money into. We heard both from the minister and also from the prime minister, actually, in the government declaration that research infrastructure is important. We'll have to invest in that. Cutting edge technology, which is also part of this, of course, and life science. So, I mean, the focus of this day is actually spot on for this area. So that is great. And as you know, there are so many applications in life science where we can use all 3, I would say, facilities. We also have the director of Scilab Lab here today, which we are grateful for. There are so many possibilities to do breakthrough research if you get knowledge and try to discuss and use these facilities. 2 are up and running, and the 3rd one on its way, actually. There we have Helmut also. So my wish for this day then, Maria, is that there is a lot of collaboration, a lot of discussion, interaction between us, both inside here, but also at the breaks, of course, and that new inspiring ideas come to life, and that we can find ways of using the facilities that we put a lot of money in and a lot of efforts, so we can actually make Sweden and Europe even better in research and innovation. So, Darja.
Thank you. Could not agree more. And that's the good cue. I guess I could also reflect on that. Yes, Drag is right, and he's putting a clear message and sense of urgency. It's also true that the ecosystem represented here today it doesn't represent the European average, but rather what we need more of. So just tying into that, what I'm hoping for today is a focus on the opportunities. The opportunities and the recipes, what have we learned in how we can really make a difference, and then commitments in doing that together. So now that it's time for the ESS and MAX IV Summit, for me, it's a highlight of the year. It's the day where we get together so that we can take stock of what kind of progress are we collectively doing in making sure that we make the most of the opportunities that valuable infrastructure actually provides. So, you know, opportunities to advance the frontiers of knowledge and boldly go where no one's gone before, to paraphrase someone else, in bringing about the innovations that we really need, that make a difference. So this year, having the opportunity to be here at GoCo is a great honor, and I think it's great. And as you said, spot on. The topic of life science, from structural biology to medical technology, it is a topic I believe everyone in this room embodies the fact that we have significant strengths in this at an exciting time, where AI and various technologies in biotech is changing the game for diagnosis, for treatment, as well as production. And then research infrastructures, ESS, MAX IV, SciLife Lab, are immensely valuable and create significant opportunities. But as we will see today, I think, it also requires tech infrastructure and innovation hubs that are designed to accelerate the innovation process. Going from lab to scale, it requires access to advanced technology, advanced production facilities, access to industry expertise, collaborations, etc. It really does take a village to raise a child, and you, my friends, are the village, right? So at Vinnova, we're really committed to continuing strengthening the Swedish innovation ecosystem in an international context, not least in the area of precision health. So for instance, just the other day, we decided to fund 13 companies, innovative companies in life science, to have the opportunity to collaborate and draw on the resources of Spatial Omics at SciLife Lab, of CCRM Nordic, of Testa Center, NorthX Biologics, Oligonova. It's going to be really exciting to see what happens. And then, of course, Vinnova will also do more. So for today, then, I would echo you and say, let's listen to each other and see what have we learned so far about how these types of structures, and I would just like to also say a warm thank you to all of you for initiating them, investing in them, working to, you know, progress our ability to do this. What have we learned now that gives us a clue on how to take things further? What kind of opportunities do we now see moving ahead? And what better space to be than at GoCo, a great example of really an ecosystem approach. So that's the two perspectives, learning and moving forward. So I'll just conclude. A warm thank you. All of you guys have a really valuable time. You're sharing it and generously offering it to each other. So let's begin.
Yeah.
Thank you.
Thank you.
Yes, it's true. This is truly a fantastic space, and me coming from partly the media world, you should have a look into the sort of media room here backstage. It's amazing. You will have many successful conferences here. And we are here thanks to two gentlemen who would like to talk a little bit about what GoCo is. We welcome up Zlatko Rihter, who is the CEO of Mölnlycke, and then we have Torell, welcome up also, CEO of Steptura.
Thank you. So good morning and welcome. So I'm some kind of host today, but I'm a host in a home that we have not yet moved into, which is maybe a little bit different. So Zlatko Rihter is my name, CEO at Mölnlycke, and we just got the keys to this building, so we're just about to move in now, and as of January next year, we are fully here. So it will be, out of 9,000 employees worldwide, it will be around 800 sitting here in this office. And right now we're downtown in Gothenburg, so we're about to move. Just short about Mölnlycke. We are today a 2 billion euro company. We are operating in 4 different areas. One is what we call advanced wound care. So that is all those kind of indications that roughly 2% of the population in every country have. hard to heal wounds. It's diabetic foot ulcers, venous leg ulcers. We talk about pressure ulcers, surgical wounds, and also burns. There are some other indications as well that we try to address. We also have an area that focuses on operating room solutions, which is all the disposables that you see in operating rooms, staff clothing, drapes, and all the components. We also have surgical gloves and disinfection products to avoid hospital-acquired infections. So all in all, that is Mölnlycke. And we will have our global R&D center here, so all the research will be done here. So we're super, super dependent on the academia, I would say, in Gothenburg over time to make sure that we get all the talents here. I think we'll talk more about that later in the panel discussion. So again, welcome, and I will hand over to Jakob, who will introduce you to this area.
Thank you, Zlatko, and yeah. So my name is Jacob Torell, and I'm the founder of GoCo. And first of all, Zlatko, thank you that you believed in us, that you took the bold decision 4 years ago to move here. 4 years ago, there were nothing here. So we are very proud today that we have moved this vision into reality. And just to give you a short background, GoCo is a joint venture between Vectura Fastigheter, which is funded and owned by Patricia Industry and Investor, and Next Step Group, who is working together and owned by Balder. And we have developed this life science eco cluster for this last 4 years. We have today finalized almost 80,000 square meters of building. In 4 years' time, we are today 90 companies working here with 2 very important focus: collaboration and speed up innovation. We have different buildings that we have tried to cluster within the buildings. So we have one building focusing on diagnostic. We have one multi-tenant building where we have room for a very small startup and scale up and larger companies. We have this beautiful building, which is not an ordinary building. It's something completely different. And we have also, so when we are creating cluster like this, today GoCo is part of Steptura. So today we are doing 2 eco systems, one in life science, GoCo, and the other one in the mobility sector, collaborating with Volvo Cars. And when we are developing areas like this, we start to create a strong vision, a brand. That was very important for AstraZeneca, who was the company that contacted us 7 years ago. It's not supposed to be the AstraZeneca ecosystem. It's very important that it has a brand standing outside Astra, so all companies can grow together. And then we after that, creating a good master plan where we can create life between buildings. We are looking into how are people moving, so we always can try to find ways for meeting, for planned meetings and unplanned meetings. And that is also very important when we are designing the building. How can we always encourage that people meet? And then we start with our community, which is a very important part, the software. So we have people employed from us that takes care about the all these common areas. So we always find good activities, everything from events like this, round table dinners, talks, different kind of events. So we always activate the areas and also try companies to really work together. And this leads to fantastic projects. We have all heard today about CCRM Nordic, we have heard about Oligonova. They are projects that have started out from discussions at GoCo, which is fantastic to see for this kind of short period of time. The next building that we are building now is this building, GoCo Active Lab. Is going to be finalized in the beginning of 2026. And it's a combination building between preventive health, focusing on that area, and GMT lab, absolutely state-of-the-art lab facilities. And we have spent very much time of doing this combination building. It will have everything from a great conference center for meetings, state-of-the-art training facilities, which is really important when you're creating an ecosystem, because everything is about attracting talent. And then Fredrik will tell you more about this fantastic initiative, CCRM Nordic. So just to sum it up, this is what we are trying to achieve, to have these fantastic partners in the ecosystem, from the public sector, the investors, academia, startup and scale up, and also the industry and interesting companies. So I will sum up with this short film about GoCo. It's like a minute and a half.
I think in general it's like you always want to make 1 + 1 become a little bit more than 2. The way to do that is to put yourself in a context or an environment where there are other players, other talents, and you have a natural connection with them.
In a space where we're trying to cure disease, things can't happen fast enough.
We need to attract talents, but we also need to make the young people here want to work within the life science sector. I want to be here, I want to work here, I want to grow here.
I hope this place will be a place that inspires people to come here and train, come here and work on their mindset, and overall feel good.
If you can create a dynamic environment where you have a number of parties coming together, working close to each other, you create a more fertile environment. Fertile environment means more development.
I see a place for opportunities to meet other people.
Allows for collaboration between different fields.
To exchange ideas, but also to reach out with new research and reach the public.
That is something that's essential in developing innovative research.
A place where we can connect for a healthier future.
When it comes to the cluster effect and why we need GoCo Health Innovation City, it's really about that Horizon 2 and 3 type innovation where we don't know the outcome. We can't form a business case. We have to start from scientific curiosity, from the desire to solve a big problem and then experiment together. That requires of people that they know and trust each other.
The collaboration at GoCo Health Innovation City, I think this is an enormous opportunity to consolidate the expertise that sits in companies in Sweden, that sits in the universities in Sweden, and bringing that to work together to a common goal.
Thank you.
Thank you very much. And just the last thing, during your lunch break, take your time and walk around in the area for a walk so you can experience GoCo.
Excellent. I just wonder about the name. When Tutti Johansson Falk, who is the organizer, the mastermind behind this day, said we were going to GoCo, I thought it was go-kart. Now I was thinking Vetenskapsrådet and Vinnova are really out there if we have the whole day in a go-kart arena.
Exactly.
But, so where does the name come from?
So the name comes from go, which is forward, and collaboration.
Oh, okay, cool. Thank you very much.
Thank you very much.
You. And Zlatko, we'll see you soon again.
Thank you.
Okay, Katarina Bjelke mentioned the new research and innovation work that's being done within the government, and we should have the Secretary of State at the Ministry of Education with us. She has sent a short message. Do we have the technology?
Dear participants, thank you for inviting me today, and thank you for organizing this conference in Mölndal on a very important theme. I am sorry I could not attend today. I do remember I attended this conference 3 years ago when it was held in Uppsala. I think I'm correct. I was then a parliamentarian on the Committee of Education, so I know that you have an interesting day ahead of you. Both ESS and MAX IV are very impressive facilities for excellent research. They are strategically very important investments for Sweden. I can see fantastic opportunities for the Swedish research community, for businesses and for the whole of society with these facilities. However, first, let me say a few introductory words about the government's general political direction and the proposed budget for 2025. Research and innovation are crucial for Sweden's competitiveness, prosperity, and ability to tackle societal challenges. The government has made an historically large investments in the upcoming research and innovation bill. The investments of 6.5 billion Swedish crown planned for 2028 demonstrates our long-term commitment to strengthening the research sector in pursuit of scientific excellence. A strong research sector attracts international expertise, and it is crucial for our universities to maintain high quality. By fostering a robust research environment, we ensure that our institutions can compete globally and thrive innovation at home. Later this fall, we will present the Research and Innovation Bill for 2025 to 2028. Significance of research infrastructure cannot be understated and is a critical area for Sweden. I am sure that providing Swedish researchers with excellent conditions is essential for advancing their work. Sweden is already making significant investments in this field, such as ESS, MAX IV, and SciLife Lab. Paving the way for future research breakthroughs is crucial for Sweden's success. By investing in research and innovation, we can develop new solutions that help us meet major societal challenges like climate change, health crisis, and sustainable energy supplies. I am convinced that it is through groundbreaking research that we can create a foundation to handle future challenges. Creating jobs and employment opportunities is a direct result of our investments in research and innovation. By supporting these areas, we open doors to new industries and services, providing more people with the opportunity for meaningful employment. This contributes to our national competitiveness in the international market. The ongoing technological shift affects all sectors, and life science is no exception. Therefore, the government's strategy for life science needs to address challenges both in the short and long term. We also need to create better opportunities for basic research to be utilized more quickly, so that we can build strong companies and provide more equitable and efficient healthcare for patients. The government also has an important role in making research infrastructure available for the life science sector, and together with other actors, creating the necessary condition for essential research and development. Registries and research databases containing collective personal data are important sources of knowledge and can be extremely powerful tools to unravel the causes of some of our most common diseases and public health issues. Therefore, the government recently submitted a new bill to the Parliament with a new regulation regarding research databases. I see this as an important step to facilitate research based on registries and databases. In conclusion, the future of Swedish research and innovation landscape is bright. With our continued investments and strategic focus, we are not only fostering excellence in science, but also building a stronger economy and a more resilient society. By collaborating across sectors, across borders, we can tackle the challenges of today and unlock the opportunities of tomorrow. Thank you once again for your commitment and for the invaluable contributions you make every day.
That was Maria Nilsson at the Ministry of Education. It sounds very promising, I think, for the sector so far. I have Katarina Bjelke nodding approvingly. Yes, Darja. Okay, this theme today, we do a special focus on life science, and we are going to call up one of the many good panels today. I think I need to be a bit of a choreographer or a scenographer here. Zlatko, come up again. We also have Fredrik Westberg. Welcome up. Jan Ellenberg and Hanna Barriga. Step up. You should all be mic'd, I hope. Welcome up. If you can gather two around each table here, please. Welcome. Welcome. I think first we do a rundown. Each one of you just quickly explain what you do. John.
Yeah, thank you very much. Thank you also for Charlie and Helmut for having us, and also for Darja and Katarina for inviting and hosting this event. I'm Jan Ellenberg. I'm the new director of SciLife Lab, the national infrastructure for the life sciences in Sweden. SciLife Lab was already mentioned a couple of times this morning, and I will say a few more words later in the
Later on. Excellent. Zlatko, we know you. Hi again. Hi again. Hanna Barriga, tell us what you do.
Yeah, so I'm Hanna Barriga. I'm an associate professor at KTH SciLife Lab. So my lab are interested in developing precision lipid nanomedicines for personalized medicine. We're predominantly funded by VR and ERC starting grants. X-rays and neutrons are really a sort of core technology for our lab. They enable us to look on the nanoscale at structures and processes to really understand what's going on and how we can use this information to develop better medicines. And we work on our own projects a lot with X-rays and neutrons, but also collaborate with both academic and industrial people who are interested in using these techniques for their own technologies or scientific questions.
Perfect, very welcome. And last but not least, Fredrik Westberg, welcome.
Thank you, Maria. So my name is Fredrik Westberg. I'm the CEO of CCRM Nordic. That has already been mentioned here a little bit. So shortly, CCRM Nordic is a national infrastructure focusing on advanced therapies, so basically the future of medicines. And we are supported by the Swedish government via Vinnova, and are establishing both production and process development facilities here at GoCo as we speak, actually. And I will talk a little bit more about this later.
Excellent. So as you can see, very qualified panel. Zlatko, Rihter, first, paint us the bigger background. What's it like to be CEO of a medtech company today? What challenges are you facing?
Yeah, if I just kind of outline really the broad picture, and I think there are many aspects of this, but a lot has changed the last 5-10 years. I think we had a kind of the pre-COVID and we had the COVID, and now we are more into the post-COVID situation. I think if I kind of outline 4 major challenges that we see, at least in our kind of daily life, being a global company, of course. It's a very competitive situation out there, but on top of that also we have a geopolitical situation that we did not have 5-10 years ago. For example, very concretely, we had to pull out of Russia 2 years ago completely. I've never experienced that in my previous 25 years in medtech. We also see a kind of a polarization out there. We see EU/UK, if we still see them as part of EU, despite Brexit, as kind of one area. We have US, we have China, we have India, and maybe Middle East, Latin America also. A very nationalistic drive. So to be part of that game, so to speak, and be able to offer solutions in those countries, it's more and more, you have to be present locally. Usually it's production or R&D or something at least. So we moved away from kind of a global strategy to very much a local or regional strategy the last few years. So that's a big change for us, how we establish production, etc. So right now we are constructing or building production units in Saudi, India, and China at the same time. And that's
let's clarify that. You need to have local facilities in order to be selling to those markets.
Yes, to be clear.
The governments demand that.
Yeah, to be part of a national tender in many markets, you need to have local production. If you don't have local production, you're excluded, or you get a very much of a niche position. So that's kind of the reality out there. You can like it or not, but that's how it looks like. I think
which governments are driving this? You mentioned China, Saudi Arabia.
India. I think US is coming there step by step. Depends a little bit how the election goes, but it's a clear trend, and EU as well. And it's not always EU. I was in France 2 weeks ago. Now it's kind of a discussion made in France. You need to run clinical studies in France, otherwise they're not acknowledged. So being a global company, this is the reality that we face.
Yeah, and are they happy with you just putting production there, or do they want higher up the value chain, like innovation?
I think it's step by step, and it's also production. I mean, in our role could be 6-7 steps from raw material until sterilization and delivery to customers. So it's different part of the value chain.
But you told me that when you established something in China, the whole local political government turned up.
Was very appreciated. So it's it's another structure there. So the whole political group basically in that region came to that inauguration, or the starting point of that.
So there are lots of gravitational fields right now in the world to pull out innovation, production to local facilities. Okay, but you are here in Gothenburg.
Yeah, absolutely. And of course, we are here in Gothenburg, and we have global competitors that are all over the place, and I think they have the same challenge. But you also have local players that have advantages in some markets.
And what type of competences do you need to find here to be able to stay and work here?
Yeah, I mean, the setup we have as Mölnlycke is that we have our global HQ in Gothenburg, and we are an innovative company. I mean, we strive to develop and innovate products and solutions in those areas where we operate. And to be able to do that, you need to have the best talents. And if you look at our competition, I mean, they're based in US, in Boston, for example, in UK, in Cambridge, and we are based in Gothenburg. So if we want to win against our competition over time, on top of the geopolitical challenges, we need to have the smartest people. Otherwise, there is no way to win the battle. And we have to be humble. Gothenburg is a fantastic city, and people move here, but it's not so easy to get people from London, New York, and Boston to move to Gothenburg. So at the end of the day, we stand and fall with academia here in Gothenburg. It's Chalmers, Gothenburg University, Sahlgrenska, because that's where we will see 70, 80, 90% of our future talent come from. So we need to be an attractive, company here. And I think one way to be that is, of course, our new head office, but that is a small part of the total puzzle at the end of the day. So that's key. If we don't get the best talents, we will not be able to compete against our global competition.
And do you feel that the Gothenburg University and Chalmers are meeting your demands for good engineers, good scientists?
I would say so. I mean, we're still alive, which is a good sign, and we're even doing quite well. But we have to continue to do that. And of course, you know, the whole kind of, you know, educational system, etc., in Sweden is very important for us at the end of the day, because again, we can say whatever we want, but if we don't have a solid, knowledgeable students here as they have in Shanghai or Boston, we will not compete in the future.
So you are kind of living and breathing the Draghi report reality.
Yes. Absolutely, and I think, I mean, we have challenges in EU, to be honest. I mean, with the regulations, etc., that limits us. And I think I saw some study. If you look at the companies founded the last 25 years and look at their value or markup, I think it's 2 out of top 100 companies that has been founded in Europe. 98 are in Asia Pacific and US.
Yeah.
And the 2 are Spotify and a Dutch chip, which I forgot the name about right now.
And Spotify doesn't create any jobs, which is a problem. I mean, it's a high value but low job kind of company. Okay, so this is a little bit of the serious background. Before we go and talk about your specific areas, any comments to the kind of challenges? Fredrik, what are you thinking?
I was just thinking about the talent attraction there, and I just want to echo Zlatko that it's so important that we actually have this really strong academia in Sweden and also a hospital sector. And to be honest, definitely we need to have and we need to attract international talent as well, but it's not on a quantity. It's more like specialists that actually can work with our really great scientists that we actually have here already. So it's not that we need to have tons of people coming to Sweden, but we definitely need competence that we don't have.
So we have the challenges on the sort of macro level, but then we also have the scientific challenges, which pose a lot of interesting opportunities. Hanna, I would like to talk to you quickly about mRNA. Which is now a very hot little messenger from the DNA. The successes of the COVID vaccines, of course, made it very interesting. There was a Nobel Prize last year, a Nobel Prize this year for a little cousin, the microRNA. What do we need to learn about mRNA right now, and why is this such an interesting molecule to study?
Yeah, so I think from our perspective, you know, mRNA has provided a technology that we can use for medicines, and we can use it. The reason it's so interesting is it can be used to make proteins in the body, and in some senses we can apply this to any type of disease where this could help or help produce a good effect within the body. We can sort of redesign it. One of the challenges with it is it's very hard to deliver, for it to end up in the right place in the body at the right time and actually do any form of delivery. And this is really what we're interested in. What can we learn about these processes? Although we know so much and there was such huge global development, and I think what was so important in that development really was this synergy with academia and industry.
You're talking about the COVID vaccine, yes.
In the COVID vaccine, where people really came together, and we've heard a lot about the sort of value of academia for industry. I think it's important to recognize the other way, the importance of industry for academia, and how really working together we can look at some of these global challenges. And for us, we're interested in understanding the sort of science and fundamentals behind delivery, because we want to use this knowledge to improve what we're doing longer term.
How is large-scale infrastructure helping you when you study mRNA and its pathway, so to say, in the cell?
So from our perspective, one of the only ways that we can look on the nanoscale at the really tiny level at these processes, the delivery technology and how it works, is using X-rays and neutrons. So it allows us to see and visualize things that we really couldn't see otherwise. So if we put it under a microscope, what we're interested in many cases, is far too small. And by using a combination of X-rays and neutrons, we can highlight, for example, different parts of the structure. How have we changed the structure? What is happening dynamically in this process? And ultimately, what we're interested in is how does this impact performance? So we really want to use this fundamental knowledge to couple with other techniques and other readouts to understand what's going on here and how can we use this knowledge to do it better in the future.
Jan Ellenberg, you, when we talked beforehand, you said this was a very interesting time in science, and you wanted to show some slides.
I can, if people are interested,
yes,
a
of
bit
course.
Of a teaser about the life science revolution at the moment.
I think we have some slides here. We talk to our master guys. Why this point in time? Excellent.
That's actually, I think, Hannah's slide.
Yeah, that's Hannah's slide. Okay.
That is the right slide. Yeah, so I think, I mean, I can very much relate to the challenges of international talent attraction. I think that is certainly something for research community we also absolutely need. And I think what helps is that we have international visibility for Sweden. But before I talk about that, how we achieve that, I think it's maybe to this audience at the MAX IV ESS Summit a good opportunity to briefly recapitulate why is this a particularly well-chosen topic for this summit, the future of life science, because we really are at a historical turning point in the life sciences at the moment. And SciLife Lab serves the entire life science community in the country. And so we get this from all our users, from the 4,000 projects every year that we support. And what has changed is really that we have increasingly in life science a situation just like in the heydays of physics. We are driven by very large amounts of quantitative data. For us, it's not only about the atoms, it's actually about the macromolecules inside living systems. And we are moving rapidly now from inventorizing living systems in terms of all the components to mapping them out in space and time. How do these molecules work in space and time? And here again, the technologies provided by the infrastructures together, SciLife Lab, MAX IV, and in the future ESS will be absolutely critical to do this spatial and temporal mapping of living systems. But that means the data we now have is quantitative, comprehensive about the machinery of living systems, and that's happening at the moment when we have a parallel revolution in computer science, that artificial intelligence is coming online and is scalable to deal with the complexity of this data and to use it to predict how living systems might function. And we can predict that molecularly, and as Hannah illustrated for mRNA, if we have molecular predictability, we can engineer, we can go in and we can change. And so that means how we deal in the future with health challenges and with environmental challenges will be rationally science-driven, and we can engineer living systems. Now imagine that future where you can use a computer to predict how something works, and you can have an engineering approach to change it so you can prevent disease before it happens.
How does that sound to you, Zlatko, if you have a computer who can predict a lot of things before they need to go into the lab?
No, I think if I apply that directly to our kind of day life, I mean, one key area, if you take wounds, for example, you never want to have a hard-to-heal wound, so prevention is extremely important. And to predict, and avoid wounds is a very big cost saving for the society and a life of quality matter for the patient at the end of the day. So I think this is one area that we really try to work with, predicting and avoiding prevention.
So it means you are bringing a lot of computational scientists into the molecular biology field.
Indeed, yeah. SciLife Lab is running at the moment a very large national research program, the Data-Driven Life Science Program, that has already recruited 40 new PIs into Sweden internationally and will likely recruit more in the future. So maybe I can say a few more words
Please, you're welcome.
I
just got curious, so please.
Yeah, because I think this is an completely global opportunity. Every country in the world is in this situation that this could happen now. So how can we do this in Sweden? And why are we maybe in a particularly good position in Sweden to do that? And I think for that, we need infrastructure. And so we need, on the one hand, the life science infrastructure. And that's what SciLife Lab really is. It's a young organization. It enables life science across institutions, across disciplines, missioned and commissioned by the government to do that, and bridges disciplines and universities. So we are everywhere in Sweden. It's a completely national organization. We are also proud to be here in Gothenburg with the SciLife Lab site. But we are importantly also collaborating not just with the academic research, but with research in healthcare and in industry, which is very prominent here today. And we are networked with our sister infrastructures here in Lund in Sweden, present here today in Gothenburg, with MAX IV and ESS, and we have actually a joint project together, InfraLife, funded again by VR, to organize our interactions. So that's, I think, something for the future. The very large
and distributed life science community to funnel their needs, to funnel the challenges, and to present them to the capabilities of the infrastructures will be really key in the future. And if you allow me, I will have one teaser of what that might mean in the future. I'm apologizing for overusing the time, but I just have to show you this, what X-ray radiation can actually concretely do for life science research. This is not data from MAX IV. I hope this kind of data will come from MAX IV in the future, and Charlie is nodding. But this is data from the synchrotron in Germany. But the technology can be used here. This is a beamline of the European infrastructure I come from, EMBL, that is using X-ray radiation to look at disease and to look at human tissue. Here what you are seeing is a whole Anopheles mosquito, which is the carrier of malaria disease, reconstructed by X-ray imaging on a synchrotron. And the data here is shown in slow motion. The synchrotron can do this reconstruction much faster than we are seeing the movie. You can now see everything outside in the mosquito, but the resolution of this data is subcellular. So you can automatically, driven by AI, segment the different parts of the mosquito, and you can seamlessly zoom in to the individual cells and structures of the midgut. It's where the parasite is hiding before injected into the human when the mosquito bites. And you can look at where the individual cysts of the parasite are inside and understand how they work with the mosquito to become infectious. So that's what infrastructure can do for life science. You could never see any of that before X-ray imaging came online. And so it's just one example of how we are in a transformation of using physics-based infrastructures that were made initially for high energy and particle physics in the life sciences.
Super interesting. Isn't this fascinating? Yes, I think it's an applause. So we have these fantastic, we have the photon, we have the neutron, high energy physics, we have a more predictive computer-based model of understanding living matter. What type of medicines will this lead to, Fredrik? What could we see? Are they more precise? Are they more intelligent, more targeted?
So talking more in a broad context, definitely more personalized, and that's the broader picture.
And what do we mean by that exactly?
So more that you actually look at what an individual patient actually need, and how can you actually direct these potential pharmaceuticals so that it's actually customized for that individual. That's one broad thing.
And to give that context, why is that so important? I'm thinking of a disease like depression, where doctors have to go months of, maybe one of you has suffered from it or a relative, you have to go through months of trying out what could work. And a third of the patients you can never even treat. So it's really a typical area of where you need a more personalized approach. Do you have other examples?
Each individual is unique. I think that's why this is so important. We can take the women versus men approach also. A lot of research historically has been made on men, and
it's because women have cycles. You see, they're problematic.
But I think that's a key thing that everybody is basically focusing on now, to get more personalized. Then, of course, I'm a little bit biased here, focusing more on advanced therapies, the cell and gene therapies that we are focusing on. Then it's the excitement there is that we actually see that we could potentially treat things that are not treatable today, and that we could actually regenerate and build up new tissue, and that's science fiction.
Wounds? Yes. Could you build up skin tissue again?
Definitely.
Zlatko is interested.
That's part, absolutely.
Yeah, there you have collaboration.
No, if I can comment as well, I think here we have a really huge opportunity with X-rays and neutrons, because one of the challenges with engineering medicines is that we haven't created the rules or the roadmaps. So we don't yet know what do we need to engineer to make a medicine for this person or this disease. And really what X-rays and neutrons might help us to do is really drive this understanding. And so through this we need to develop the technology to understand what we need to make for a specific use case. So some of the opportunities there around driving the collaboration and technology within Sweden so that we can lead the way in doing that, I guess.
Do we have the talents in Sweden to benefit from the facilities in the life science area?
I would say yes. So I think the talent is here. I think we can attract even more. No. But I think we also need to work on the use and accessibility in the community, because I think that is something not every life scientist is aware of what can be done at a large infrastructure. And the big user communities we have in SciLife Lab, I think only very small fraction of them actually is aware or is even using the availability of the physics infrastructure. So I think here strategically working together and identifying what are the big questions ahead and how can we provide jointly the right services so that this also is easy for the community to use, I think is a work to do for the future from my.
We will have an entire panel on this, on the bottlenecks. But what I think is interesting, because we will have some groundbreaking research being done there. We saw the malaria mosquito. And how do we facilitate so that it goes from the facilities, the discoveries being made, to being actual products that Zlatko can sell in Saudi Arabia, for instance? How do we, because that's going to be ultimately what creates a better Draghi report the next time. Fredrik, what are your thoughts?
Yeah, I can just mention one thing there, and that's basically why we are existing, and that's pretty much to help get this really great research that are existing and kind of bridge over this valley of death that you normally talk about, that it's so expensive and tricky to actually get this innovations to the patients in the end, and that's why infrastructure can play a big role there, and that's now we focus on a niche part, and that's cell and gene therapy and advanced therapies. But I think that's it's well invested money to actually focus on that in the future.
And I think there are many different types of users for these facilities as well. So there are the people working at the facilities who have this really technological knowledge. There are other users that are driving new technologies at the facilities, but there will also be users who really just are interested in the scientific gains or understanding from these facilities. And actually we kind of need to cater for all of this across academia and industry, that we have the sort of people who want to develop and drive the technologies for fundamental research, but also those who just are interested, like you say, in the scientific gain from these. And they're very different types of user communities.
Zlatko, comments about this?
I think in one way for us to kind of be part of this is that I think what we've changed the last few years also is that I think one of the key kind of activities and tasks that we have as a company is truly to understand, the patients and healthcare systems needs, and how do you find out kind of the key pain points basically, and then turn that into innovation. And I think that is a skill set that we need to have. And traditionally, we did a lot of R&D in-house. What we see now is that even if we have like 400 or 500 people sitting here in this building soon, working with R&D, they need to be skilled to be out screening, finding partnerships, collaborations, etc., around the world basically, to find the best technologies, match this kind of customer need or patient need that you've discovered. We are niched into wound care, for example, and find the right technologies that we can kind of co-develop, finalize, whatever, and commercialize. And I think that is some of the skill sets we need to have and really understand. So I usually say, like, we're a fantastic company, we're 9,000 people, but there are 8 billion people out there in the world, and there might be a small chance that somebody outside our house has come up with some good stuff.
So a question for you then is, the markets you are in, are the healthcare systems ready to pay for innovation? So I think I'm asking this because if we look at CNS, all the diseases of the brain, the healthcare systems, I know especially in Europe, are not willing to pay really for innovation. They are willing to pay for innovation in the cancer area, maybe heart disease, but CNS has been like a lower cost has been set per patient, which means that it's very hard for companies to be innovative, especially passing the blood-brain barrier. It's expensive science. So your clients, are they willing to pay for this extra level of sophistication? Because it's going to ultimately be decisive.
Yeah, and I think, the world has gone, and I'll kind of answer it, not directly but indirectly. I think if you look at what's happening out there right now is that we have a kind of a healthcare system that is under enormous pressure. So if you look from the clinical perspective today, we see clear migration from kind of acute care to non-acute, post-acute. So basically, short stays in the hospital and then get the patients as fast as possible out of the system to the home.
Do you recognize this? Do you have a relative who's been driven home basically after the operation? Hand up. Yeah. We know what it looks like.
Yeah, so I mean, day surgeries, you have a hip surgery, you go home in the evening basically and do overday stuff. And I think that's kind of the driver. So they are prepared to pay if you can help them with not only the clinical outcome, but also the health economics. And explain that in a good way. So if you do that and invest into that, you save that much. Not everywhere, but in many markets. I think we talked about prevention before. I mean, we and other companies have solutions to prevent wounds. In some markets, like in US, where you have as a hospital, you can pay a fine if you have a hospital-acquired wound. There is an incentive to do that. In Europe, it's not. So prevention is very limited in Europe. So you know, there are ways to do it, but there needs to be incentives. It needs to be a drive also from the politicians to set the structure, basically, to do that. And then you need to understand kind of the holistic end-to-end part of the treatment.
Yeah, I can just add there, if we look at more the future medicines and the more advanced medicines that we're working on, they are super expensive today. And of course, what we need to do is, it is a massive challenge with the health economics, but we need to change the view there and look at have a longer perspective. Because to be honest, if you look at the neuro field that you mentioned, it's if you get a neural disease early, you will cost a lot during just to treat those patients over many years. And if we can actually do a treatment that costs a lot of money, but will actually cure your disease, of course that will change the game completely. But we need to work here, definitely.
Our two scientists here, what are you thinking of this for healthcare systems? Willingness to pay for innovation. What are you thinking? Hanna, what are your thoughts?
I mean, I think it's a challenge because some of the techniques that we work with can give answers very quickly, and some of the techniques that we work with, there's still a sort of technological development needed for us to be able to sort of for example, take a sample from a medical provider, do an analysis with X-ray and neutrons, and then supply them almost with a sort of report answer about, well, if you do X, Y, and Z, then this will help you create a better medicine. But I also think we kind of need to have that vision that that's where we would like to go, so that we really lay the sort of groundwork. We remove some of the bottlenecks, for example, with data analysis, and we say, well, where would we like to go? And then how are we going to get there? And I think they kind of, will go hand in hand.
Is there an argument to be made that with the more precise diagnostic techniques, we can sort of speed up the process of innovation in a way, so ultimately it'll make innovation less expensive?
I think that's already happening. So I think we are really at the beginning of the revolution of rational deployment of scientific methods in healthcare. That has happened in genomics, large scale in terms of genome sequencing. That is now a routine healthcare provided new technology that is 20 years old. But all the new technologies that have been developed afterwards are not yet in the clinic. So that is going to happen much faster. We have now all the levels of molecular information after the genome to the business end of what actually happens in organisms, which is mostly protein metabolite level. These technologies are there now, but they're not used clinically yet. But that transition and that translation strategically will follow the blueprint of medical genomics, and it will happen much faster. And so that is already generating spin-off companies, new services, a whole ecosystem around those basic science technologies. So that's happening already, and it really fuels this.
So a final comment from each one. What are you seeing within the next 5-10 years in your field that you think is really interesting? Who wants to start? Fredrik?
Oh, it's so much. I actually thought about I thought about one thing that I think is so important, because the new fields that we are working on it is still immature and it's very broad and there's so much possibilities. But I think it's super important to really focus on the commercialization part, that you actually do the right things from the beginning so that it actually can be a product in the end. I think it's a lot of products or projects aim to be first in man very quickly, and then kind of, okay, then it's really tricky to actually take it to the next level and scale that up. This wasn't really answer to your question, but I was just thinking about that now when we talked about innovation. I think it's really important to kind of gather these innovations and make sure that they actually have a commercial way forward as well.
Hanna, what are you seeing? What are you thinking? You are using the facilities already, you told me.
Yeah, so I think for me, one of the big excitements is that there's a lot of software development, technological development, and integration across different platforms. And for me, that's the really exciting part, that we can go from really a nanoscale understanding, for example, of the rearrangement of components in a tiny, tiny particle to how that actually could impact a patient. And the only way we'll get there is really by linking the technologies, the software, the development, to really go that full scale and start to provide rational engineering, actually.
Rational engineering. Has engineering been irrational before, or?
I think not, but it's not easy on the nanoscale. So we can engineer the changes that we think will make a difference, but actually it would be much better to engineer the changes that we know will make a difference.
Jan?
I think I outlined the turning point in life science at the beginning already. I think there is really a historical opportunity for moving forward and for addressing health and environmental issues in a qualitatively new way. These are things we cannot do in the cloud. Our health, the environment we live in, is the physical reality. We have to deal with that in practice, and I think this is a global opportunity, and I hope that in the next 5 years, Sweden can become a leading nation in that competition to lead this revolution by the investments into research infrastructure, and by really also combining the fields between life science and physics.
Good. And Zlatko, I have to ask you a question. You have to answer me honestly. Before you were contacted about this day, did you know about the ESS and MAX IV? Have you heard about it?
Very much, since I'm from Lund. So
you are from Lund. Oh.
I lived 25 years just next to it, so I see it being
You know all about this. You know all about this.
Yeah. I'm partner in crime, you could say.
You're partner in crime. Excellent, excellent. And what are you seeing in your field? And when you hear about the facilities, what are you thinking about the years ahead?
I think if you take a 5 to 10 years perspective, I think there is a term coming up more and more, and I hear that more and more when I'm out in the world, and that's kind of sustainable healthcare. And it's basically two components of that. One is around circularity, you know, the CO2 decrease, bio-based material and all that, because I think if you take healthcare, if that would be a country, it would be the 5th largest polluter of CO2 emissions in the world, basically. So I think that is one part. But the other part, which is also sustainable healthcare, is that the well-being of healthcare professionals, physicians, nurses, etc., everybody that are working in the hospital systems or healthcare systems around the world, we have an issue there right now. They're leaving. They don't want to work there anymore because it's not sustainable. And no matter what we do in research and everything else, if we don't have people that want to work in healthcare, we will have major issues. Part of the solution will be around the digital solutions that you automatize, you make it more efficient. We talk about commercialization, so you have more kind of digital operating and business models, but we need to take care of the staff that is left there, because right now it's going in the wrong direction, I would say.
Why are they leaving?
They had pre-COVID, they worked like hell. Then COVID came, they had to work even harder. And then they thought, oh, now we can relax. And then they said no vacation, because now you have to take care of the backlog post-COVID. And if you ask people to work 24/7 for 5 years, there is a risk that they might think one day that, well, I might be Florence Nightingale, but at the end of the day, I also have to survive. And that's what we see. And we see daily when we're out there that we have less and less skilled healthcare professionals. I mean, they find other jobs. You have the consultant nurses, etc. So when we try to train staff on our products, if you have a 4 times training over 6 weeks, you meet new people all the time. So that is also a reality that we need to take care of.
Yeah. So you can have the best products in the world, but if there are no nurses to administer,
it's hard.
It's very, very hard. Okay, I think we should give this excellent panel a really warm round of applause. Thank you very much. So, Zlatko told us he has been living next to the facilities, and if you travel outside of Lund, you will see the spaceship. Looks like a steel bagel. MAX IV, the big science facility using electromagnetic radiation generated when particles at enormous speed are forced to travel in a circle. synchrotron light. Olof Karis is the director and here to give us a quick introduction to ESS. Oh, sorry, MAX IV. Got to keep it right.
Oh, I should bring my notes. I thought we were starting with a movie, right?
We see imaging coming up at several different beamlines. We do see medical experiments at 4MAX and DownMAX and SoftyMAX and NanoMAX. So there is a lot of stuff going on. The portion life scientists coming to MAX IV is really growing, and there is really a potential for further growth. We have come from an area where we really looked at pictures, static pictures. Now with the new technology, we can actually go towards movies.
Maybe I should take the opportunity to say that this is a fantastic place to work in. The beam has a fantastic quality. It's very stable and it has a small focus. We are working on the properties of the pig heart, mainly because it is very close to the human heart, and it has also been potentially a source for heart as a transplantation donor. The focus of our study here at MAX IV was to study the structure of cardiac muscle in a very special situation called the stone heart. When the heart is exposed to severe lack of oxygen, then you can get a very severe contracture that the heart gets into some kind of spasm. We found that there were no evidence for shrinkage at the contractile filament level, and we could measure that by using two very strong scattering reflections.
Universal blood is a type of blood which have been stripped of some specific markers that are recognized by antibodies in recipient blood plasma. We have discovered a set of enzymes that are grouped in two enzyme blends. One of them was able to convert the group B canonical antigen, but additionally an extended structure which has been recently discovered by the group of Martin L. Olsson. Similarly, for the A blood group, we have been able to discover an enzyme cocktail of 3 enzymes that were able to handle the canonical A antigen and 3 of the extended structures. These enzymes together enabled us for the very first time to identify the extended structures as important antigens that define the phenotype of the A and the B blood groups. And what this meant from the universal blood type of perspective is that we have now an entry to truly address generating enzymatic universal blood. So these fantastic crystal structures that we have obtained were generated at Biomax, and the quality and the resolution of the structures in different states and bound ligands enabled us to derive instrumental information to explain the mode of action of the enzymes.
Okay. I think it's a good starting point to actually look a little bit at the background of this picture. You are looking at ESS in the front of the picture and MAX IV within 500 meters. This is a 10-minute tram ride from Lund Central Station, and it's about a 1-hour train ride from Copenhagen Airport. I think these are not only world-class facilities, they are probably also the best connected world-class facilities that you find anywhere. So there are very few places where you can travel from basically anywhere in the world and get to these absolutely astonishing facilities within an hour. The picture also tells you a little bit what is actually missing. if you look between MAX IV and ESS, you don't see GoCo. So that is, I think, something that Sweden has to fix, because we are now having the two best facilities, or some of the best facilities in the world, that will offer so fantastic opportunities. But between these two sites, you have a greenfield site that contains an animal house, which is not a small thing, but it should be filled with something much more. So I think that is, a challenge for Sweden to fill that with the usable contents for all of us. So I'm not here to talk about what is known as Science Village. I'm here to talk about MAX IV. MAX IV is the first fourth-generation machine in the world. It's a fantastic piece of innovation, and we're still signing new MOUs with countries around the world. The latest is from Korea, where they want to learn from MAX IV on how to develop these fantastic facilities. So what does it mean that to have a fourth-generation machine? Why is that relevant for life science? It changes the optical quality of the X-rays, and we can do experiments much faster because we deliver all the useful X-rays at where we need them at the sample. But also the optical quality of the light is very, very different today than it was earlier. And Jan showed images that were not able to do with the quality of synchron light we had in the past. We need these new machines to enable this type of science. And I think that is also a direction, indeed, that we will develop MAX IV, and hopefully also to deliver a very, very competitive imaging facility for life science in Sweden. So with these new imaging capacities, we can really do things like the Brain Connectome, which is a big project now within the EU, where MAX IV is also a partner in that. And we can image things like plaques in Alzheimer's disease, and we can do elemental maps of these plaques. So again, it is highly relevant to be at the fourth-generation machine, because these are really the enablers that allows us to do this type of science. MAX IV, I think, is already fairly well connected in the community. We through InfraLife, we are connected with ESS and SciLife Lab, and I think that has been quite instrumental in pushing the use of these facilities in Sweden. And let's see how we continue this. I think there is certainly a good reason to try to ensure that we can work together also in the future in a similar spirit like InfraLife. This has given us several things, like the integrated structural biology course, which was during the summer realized. No, it was actually in the fall. It was realized in its second inclination. MAX IV today admits about close to 2,000 individual users. We have accumulated 2023 about 650 publications. We expect to increase our publication rate and pass 300 publications per year. A good level of publication for mature facilities, about 20 per beamline per year. So I think there is room for improvement for MAX, but we're picking up quite well. Life Science has been a part of MAX IV since the very start, the first experiment, 2017. First industrial user in the life science sector were at MAX IV 2018, 2 years after the inauguration. So a very, very strong community with a strong presence at MAX IV. It is also today the largest industrial group. About 80% of the beam time we sell is from pharma. So MAX IV, I think, in terms of throughput, is a very unique facility. If you go to Biomax, you can screen almost somewhere between 20 and 25 structures per hour. So you realize if you spend 10 hours, you have screened quite a lot of proteins, or the structure determined a lot of proteins within that amount of time. We also have new access models that are really developed jointly with industry. So today, you can actually just request, you can mail in your sample, you can request data to be taken, and you'll get the data back within a week. So you don't, as an industrial user, you don't even need to come to MAX IV. You just get the data sent back to you within a week's time. Okay, so I think coming back a little bit towards the imaging aspect and also more techniques, we are seeing that the life science sector today is developing their methods to use techniques that they have not really been using in the past. Biosax is quickly picking up, and certainly tomography on the beamlines that are not really yet fully adapted to accommodate life science users. But still, because of the scientific potential at these fourth generation machines, we're seeing a lot of life science experiments coming in and using the facilities. So looking ahead, I think MAX IV is now trying hard to find the funding to develop a dedicated tomography facility for life science, where the presence of this little animal house will be a unique feature, and hopefully we can also offer, of course with limited resolution, but in vivo imaging, where the fact that we can rely on phase contrast rather than absorptive contrast actually allows you to study your rodent and still keep it alive, because you don't have to have such high radiation doses that you will kill the poor pet. Okay.
Sounds promising. What about humans?
I don't think we want to put humans into the beamline, no. At least not in vivo.
I was thinking of the personalized medicine
yes.
a couple of years down the road. So you've been up and running for 8 years. You said you started working with industries within the next 2 years. All these big user group, and you have many industrial collaborations, you have research, etc. around you. What has been key drivers in this success, do you think?
I think that is certainly sector dependent. I think when it comes to pharma, there are very few methods that give you that type of throughput. I mean, we have actors that screen more than 10,000 protein structures within a year. If you try to do that with other techniques, there is no alternative. On the other hand, I think if you look at the new techniques like Biosax and so on, I think here the groups are slowly seeing what type of opportunities you have with these new methods, and they are slowly sort of working therein through collaboration with academia and so on. So I think to give you a simple answer is not so easy. It's ultimately dependent on which sector you come from.
And what technological benefit you can provide to the sector, yes. Yeah. Okay, so we talked about collaborations being an interesting theme, GoCo, MAX IV, ESS. I think if you want to expand to Lund, you will have some interested people here. Pia has been very involved in this too. That's an excellent opportunity. Thank you very much, and congratulations on all the success. And now we will do a favorite activity, Swedish activity, drink coffee. You will have 45 minutes, and thank you. And we reconvene here again at 11:15. So let's see if we have sound. We have sound. And there we have sound. I'd invite you all, welcome back to your tables. We started off talking this morning about how breakthroughs in bioimaging, AI, and so forth are interplaying with the new technologies. And we are going to delve a little bit further into this topic. I'd like to call up the panel that's now nervously waiting at the table. We have Erik Lindahl, Professor of Biophysics, Stockholm University, Mariana Jannes Arteta, who works with drug delivery at AstraZeneca, Frederica Sabastini, who is at the Copenhagen University, and Chris Schlenk, who is Group Vice President of WellSpect Healthcare. I'd like to quick round of presentation a little bit. Begin with you.
Oh, I'm Erik. Once upon a time, I was a theoretician, even physicist, and then I've had a long, complicated journey over membrane proteins, ending up in the lab doing structural biology nowadays, and somehow we're back in the middle of everything with artificial intelligence nowadays.
Perfect.
So my name is Mariana Jannes Arteta, and I work in AstraZeneca. I work in a department called Advanced Drug Delivery in Pharmaceutical Sciences, leading a team of scientists to do what we call new modality clinical formulations. So that's actually a very exciting field and connects with what we discussed early in this morning. But I also have a background in using large-scale facilities during my PhD at Lund University.
Federica?
My name is Federica Sebastiani, and I am a assistant professor at the University of Copenhagen in the pharmacy department. Well, I grew up in facilities. That's how I like to see myself.
You grew up in facilities?
Yeah, using neutral facilities, in particular ILL. So I am a user of those facilities, and I try to use them to understand better drug delivery systems.
Yes, and hi, my name is Chris Schlenk. I lead WellSpect Healthcare, which is just across the way. It's a subsidiary of Dentsply Sirona. We, as I mentioned earlier, are very focused on next generation of material science, especially as related to plastics and the sustainability, as many of our products are for chronic use and are used for the duration of somebody's life. And I am a new Swede. I moved to Gothenburg with my family in January.
So we heard before, Zlatko said nobody wants to move to Gothenburg. So what attracted you to Gothenburg?
The weather, for sure.
Congratulations. So Chris, you work with developing products to support urinary and gut leakage problems. These are complex areas, and they're also highly stigmatizing for the patients. And I guess in terms of material development is very, very important to you. How are you advancing that frontier right now?
Certainly. There's really two ways we look at our innovation. One is in terms of patient and user comfort, and the other is antimicrobial and anti-infection surfaces for clinical benefit. So we have many partnerships with academia, one of which is with Chalmers University, for instance, where we're researching graphene or nanostructured graphene, and we have an extended partnership with MAX IV to test some of those surfaces. So
graphene as a material used in like urinary leakage, continence support, or how are you seeing that being used?
Super versatile material, as I'm sure most people know. We're studying it for application in antimicrobial surfaces for our catheters to prevent infection after long-term use.
So what are the problems that patients are facing right now with the materials in terms of catheters?
Just the nature of that particular category that we have solutions in is that people have to catheterize themselves several times a day because they have neurogenic bladder, which means that they can't necessarily control their urinary functions. So if they have to catheterize themselves multiple times a day for the rest of their lives, there's urethral trauma, and it's a breeding ground for bacteria. So to the extent that we can bring to bear solutions that are antimicrobial and can help prevent infection, It has both clinical and quality of life benefits.
From a point of curiosity, how do you study if a material is more or less prone to being bacterially infected? Because you've got organic, inorganic material. Do you sort of measure how the bacteria climb on the matter, or?
I suppose that's one way to look at it. I think there are known substances that are not conducive for bacteria to thrive on. So we're trying to find ways to introduce those in a product solution to ensure that the colonized bacteria within the urethra don't have what they need to live.
Yeah. Starve them sounds like a good idea.
Yes.
Okay, Erik Lindahl, you talked about your background. You're a physicist, you went into biology, and after I had talked to you, I was thinking, I'm a biologist, I'm a geneticist, so we did a lot of mathematics, but I was thinking, is biology dead today? Because it's all becoming computational, AI, computational of big data. What are you seeing? Is it dead as a descriptive science?
No, it's finally become a descriptive and quantitative science in particular, right? Rather than being a phenomenological science, it's more alive than ever. And
it's more alive than ever because you can quantify things.
Exactly. It's gone from phenomenological description to quantitative description. That's starting with sequencing. And once we're quantitative, we can push things into computers.
Mm. So it's interesting. I'm a popular science writer, and I've just been working on a book on longevity on all the new research at the frontier. And one of the people I've had the privilege of bouncing ideas off with has been a nanophysicist. That it's interesting. So this merger of physics and biology, we're really seeing that. What can the physicist bring to the table of biology?
Oh, that's a hard question. I'm not really sure I dare to call myself a physicist. I probably lost my physics driver's license many years ago. To me, the big really productive intersection is really about biology on the one hand, life science, medicine, and on the one hand, information sciences. What we can do, AI is a buzzword, but just judging this year's Nobel Prize and everything, once we learn to quantify things, once we learn to put tokens, words, once we develop this language, there is a revolution waiting to happen. But today, I would say that revolution is mainly in the interface between computer science and biology. Mm. Doesn't make physics unimportant, because we still need to collect the raw data, and we couldn't do anything without that raw data.
We'll get back into AI because it's a huge topic, but I would like to go back to the pharmaceutical industry. Mariana, you working with early clinical trials, how does working with the big science facilities fit into your needs?
So our department works what we call the drug product development. So we take the molecules that are found in the early preclinical research in vitro or in vivo models, and then we actually need to make a product out of it that can go into clinical studies to prove that they're safe, that they work as they are. What happens is the classical pharmaceutical was built on small molecules, and we are now moving in what we call new modalities. We heard today about oligonova, so oligonucleotides. We talk about large molecules, we talk about mRNA, lipid nanoparticles. So now we try to deliver very complex systems that have to pass through many different barriers in the body. And we need to understand how they look in our product, how will they look when they go inside the body, so we can make better, faster, more efficacious and safe systems. Because the new life science problems are much more complex.
Mm. It's often said in the pharmaceutical industry, the low-hanging fruit has been picked. You're now just working with really difficult things. Fredrika Sebastiani, you work with vaccine delivery and with a keen interest in studying biological structures. How can understanding structure help us understand function even better? How do you see the two interconnected?
Well, I think it's a little bit connected to what Anna was talking about as well, that if we understand the structure, so that means that we know a composition. So now we don't, for example, the lipid nanoparticle is a multi-component system. So there are several things playing a role in the final product. And we have tools to study that very carefully before they get into the body. So the structure, it's kind of easy to understand at that step. But we still miss the link between the structure before going into the body and when is in the body, and how the interaction with the systems in the body actually affect the function. And if we could, so that's kind of a bit more, a deeper structural analysis. If you could actually understand the structure while it is going toward the target, we can add on the performance in the end.
In the end, yeah. Is there like a qualitative or a quantitative difference between how pharmaceutical companies on one hand and the med tech companies on the other hand will use big science facilities?
I guess that question is for me. So I will say, I mean, AstraZeneca is a company that has been used in large-scale facilities for a long time, and there are many different applications. So sometimes I sit here in a drug product development hat, but I mean, protein crystallography is one of the main applications, and we use MAX IV and other facilities in Europe quite frequently. I will say that it depends on the scientific question that you're posing there. So what is it the benefit, for example, for other companies like Mölnlycke Healthcare that are developing different type of products compared to us? How do we connect? Because we actually do have an overlap even outside the MedChem area with other companies like sustainable materials. So I think we need to understand what is the scientific question. One of the things that I really like about working in a pharmaceutical company, but also having a background in large-scale facility, is that I feel like I actually speak many languages, so I can understand the questions from different perspectives. So we all have a scientific question, we just need to find a way to answer it together.
Erik, when we talked about this beforehand, you said it's interesting when we study organic and non-organic matter, because the non-organic matter is more different, it's more varied. Can you elaborate on that?
Well, I would say that when it comes to finding patterns or so, right, the key difference, it hasn't undergone evolution, for better or worse. And that, of course, makes it very diverse, but it's also easier to find the patterns, because the patterns are frequently interpolation, between different atoms. The challenge, of course, you can't learn about gold from silver, because gold did not evolve from silver. And the beauty in biology, we can't cheat this way, that proteins have evolved from other proteins, have evolved from other proteins. So by frequently, many of the things that we have historically tried to approach with physics, for instance, protein structure, we've over the years learned that it's much better to cheat, because in this case, we are allowed to cheat by learning from 4.3 billion years of evolution instead.
When you are listening to this case, which is very theoretical, how are you thinking this will be applied? The collaboration you do already now is with Chalmers?
Yes.
Yeah.
One of them, yeah.
And one of them. And what is the specific scientific or technological question that you have posed to them that you want to have solved? Is it only the bacterial interference with the catheter, or is it?
In that particular collaboration, it's really studying how that substance of graphene can be used in versatile ways to address the colonization of bacteria, and really in that segment of the industry, the holy grail is finding products that have characteristics that don't allow for that bacteria to grow.
Yeah.
So it seems like it's easy to do on a kitchen surface with chemicals, but something that interfaces with your biology several times a day, it's very sensitive and very advanced kind of science that we have to work through.
And this must be very urgent too, because we're seeing antibiotic resistance growing all over the world because of oversupply of antibiotics. So this has to be solved before we are all antibiotic resistant, or?
Yes, many things have to be solved before we're all antibiotic resistant. This is no different. So for our target population of people that we serve around the world, they're already very health compromised because they've had a traumatic injury or such that requires them to use our products. So it's extra urgent for them because they're susceptible to diseases that would be not fatal for us, but because of their current state, potentially fatal for them.
If you do these breakthroughs, let's say you find composite material, graphene, which is more averse to bacteria, so to say, will your clients be able to pay or want to pay for that level of innovation?
Yeah, so Zlatko earlier made a great point that depending on where you are in the world, some health systems are willing to pay, the US for instance. In this space, it's more of similar to a pharmaceutical. It's reimbursed at the patient level through government tenders. So we've been able to show that innovation is rewarded in the chronic care medical device space when you can prove clinically that there are benefits and clinical outcomes.
It's interesting because I think the European self-picture is that we have a very good healthcare system, but you're saying that the US system would be more willing to pay for a more innovative product.
Yes, but there's many reasons why. The US healthcare system has started in the last number of years to pay for outcomes, and it's a slow process, but hospital-acquired infections and long-term complication reduction has been a focus in the US, so there's been a willingness to pay, but I don't think that makes it superior.
And the European system pays for process? A lot.
A lot, yes.
A lot, yeah. So you get different outcomes. What is your opinion about this? Is healthcare systems, are they willing to pay for innovation? That's the balance you have to strike.
Yeah, I think, of course, we are a bit of in a privileged position because as a company, we're a global company that we strive to develop innovative medicines. I mean, we're not focused on one modality. We're actually looking at the medicines in the future. We're focusing on addressing the patient needs at different therapeutic areas. And I mean, that goes from maybe more known or common indications in the global population, but also to rare diseases. And when we look at the rare disease area, that's very interesting because how do we treat a population which is so difficult to find as well, and it's also to find the root cause is almost sometimes as finding a needle in a haystack. You know, it's to try to understand more about the genome and to try to develop those products. So I think in our case, we leverage our global footprint to be able to bring that innovation into the table. But of course, AstraZeneca has a very strong presence in Sweden, both in the R&D side here in Gothenburg, so that's why we're very happy to be very close to GoCo, but also in operations in our manufacturing facilities just in the south of Stockholm, in Södertälje.
We started talking about AI as a way of interpreting data and start looking at things. So how can AI, because you're working with this, Eric, right now, and you got a grant for this, how can AI start processing the enormous, because we're going to go into this later today, the enormous amounts of data? You gave me a good example, 3 months to plan for an experiment, 1 day to perform it, and 3 years to interpret.
Yes, and that's how we've historically done it, right? And there are so many cases. Even this year's Nobel Prize for Chemistry is the culmination of 50 years of work of collecting protein structures. But it takes time to find these discoveries. AI, or whatever you want to call it, machine learning, is still on a very low level, and we're all impressed. You know, everything started out with simple pattern matching, finding correlations. And it's fun that there are so much things in popular media and everything that we start thinking that we would jump all the way to robots. That's not going to happen. But the interesting is the next small steps. When will we will start using computers as cognitive companions. The computer might actually know, oh, there is an interesting pattern here in the data. Maybe you should try this material too. And that might be wrong, but my guess as a scientist is also frequently wrong. And the computer can make more guesses than I can.
Sure.
So I think many of the things that we've historically thought of as intelligence in science really comes down to blood, sweat, and tears. And the computers might not be great at the real intelligence, but they are pretty darn good at blood, sweat, and tears.
Albert Einstein said, "I'm not more intelligent than others. I just stick with problems longer."
Yes, and the computers are able to work 176 hours per week on them.
Yeah. So could you elaborate on what type of patterns could we imagine that AI could detect that would take so much work from humans that we kind of miss it? Could you give some examples?
So no, again, coming down to proteins, I think it's a great example. All the success in protein structures is really based on that there are very weak correlations, that parts of proteins, amino acids, that if they sit close to each other, they tend to correlate. But sometimes they correlate very, very, very weakly, even if they are far apart in the sequence. And that's because they're close in space. And that means that they influence others through evolution. But it's exceptionally weak patterns, and you have to dig through 500 billion sequences to find this, right? The computers can do that, but there is no way a human ever could.
What are you thinking, Frederica, when you're hearing about this ability of AI to detect variations in structures? How is that useful?
I think it would be very useful, but I think we still don't have the data organized in a way that is actually accessible to AI, because for protein crystallography, there is a very well-constructed database, and everybody adds the same metadata, etc., all the information, while for data from scattering, it's less common to have that. And I think that would be the stepping stone to then move forward.
No, definitely. And I can just add that you're all hearing of these language models, right? But they're not languages in terms of English. These words can be anything. And the scientific, we need to develop these words in different domains. In neutron scattering, what are the words? I don't really know. But once we crack those words, we will be able to start applying models like that.
Yeah, sure.
How are you working with the data today? How are you interpreting the big data that you collect? What are the methods you are using? How are they insufficient?
Well, it really comes down to the person that stands in front of the data and try to fit the model to it. So it's really based on the expertise of the person looking at the data, and it's a very difficult knowledge to transfer as well. So of course it would be helpful to have a more systematic way of doing that. So yeah, there is a lot of room for improvement on the data analysis. And I guess this would lead as well to other users that are not interested in developing new ways of analyzing data or new technology, but just users that want to get the results out and see how that can help to push forward their science, to use the techniques. Because yeah, the data analysis, what you said, the 3 months, 1 day, 3 years is true. And in the 3 years, if you don't stick with it, you will lose all the work you've done so far.
Sorry. Chris, how does this sound to you? 3 months to prepare, 1 day to do the experiment, 3 years to collect the data for you running a business with shareholders and being able to, do you feel, wow, great, I really want to go into this? Or what are you thinking?
Yeah, there's no patience among shareholders, for sure. Our clinical trials tend to not be as extensive, just the difference between MedTech and pharmaceuticals. However, all of this resonates. I would say AI plays an important role for us when we start a clinical trial with an intended purpose. We generate tons of data that's applicable, but we don't know where to look in the crosstabs, if you will. So the AI gives us an opportunity to kind of feed all of the data into the system and then find things that we weren't looking for to create the next study. So it allows us to iterate and...
Are you using it already?
Yes.
Yeah.
Yes.
For especially what, evaluation of clinical trials, or?
Correct.
Correct.
And then the next step in this is population health. So we provide services around the world to our patients, and in that we collect tons of data that once we figure out the system to make that useful, it's going to allow us to provide more personalized service and maybe even get in front of some future complications they can have from the treatment.
Mariana, what are you thinking? How are you getting your data? How are you analyzing it? Are you using AI, and to what extent? How are you seeing this?
Yeah, AstraZeneca is quite committed to using AI and other machine learning tools to accelerate our development. And since we are end-to-end, I mean, from early discovery up to commercial, we have different areas where we can apply, and we have different departments within our company that can actually focus on the specific questions as well.
Which areas are you in? What specific stages before to drug discovery up to phase 3, where is it especially helpful, would you say?
Oh, I would say multiple, all of them. I will say in the early discovery, when you're screening compounds, we have a lot of what we call the high throughput screening, so you can generate tons and tons of data. And then, I mean, for a scientist, just looking at the data and pick what are the best, that's not easy. So AI can help us with this. Then when we're doing product development, it kind of falls as well to what Federica was describing. And if we're going to develop better products, we need to understand the data, and we cannot have 3 years to understand how this product could be better. So we actually also partner with other companies. I know Vinnova has a program right now on AI Sax, for example, led by Tetra Pak. And that's an initiative in Sweden to try to get that data, more understanding on the data. We also do it on clinical trials, but we also have to have, of course, the consideration on ethics. And one of the challenges as well is to make sure that we don't cross that boundary.
I'm thinking of, we're seeing, of course, all the advantages of AI, or maybe we cannot even envision them, but will we have machines that know more about the human body than we do ourselves?
Something tells me you don't know your entire genome, so there are already such machines.
Yeah, yeah. I know. Have you done these saliva tests and sent into MyHeritage? Has anyone done that? Or Ancestry? Exactly. I was just thinking, shit, I sent my whole genome away, and they said, do you want to know if your risk of Alzheimer? And I've said no, because it's not actionable, but we're already doing that, yeah.
I'm not so worried about that, actually. The part that worries me is that things are moving very fast in the world. And I think for many years, those of us in science, we were under this, well, it's only the industrial part of Google and Facebook and Amazon. But as we're increasingly seeing, they're gradually stepping in, even in basic science. And things that used to take decades now happen in months.
But do you want to have
They move insanely fast. So there will be drawbacks here, right? But I think the only lack of knowledge, I can never see lack of knowledge as an alternative to knowledge. There will be knowledge that we need to learn how to handle. There are ethical concerns that we need to do research in. But again, lack of knowledge will never be better.
Okay, so the counter argument to that would be that we were created to know some things, but some things are just too difficult for us to handle. We have the biblical story of the apple of knowledge, etc. We know how that ended when the apple was eaten. I mean, what will this mean for us? If your genome is out in the world being discussed by science, you have no idea about it. Are you comfortable with that?
It depends whether it's coupled to all my personal information or not. So if this is connected to my medical records, I wouldn't want this to be online. No, but the genome itself is slightly related to me, but to me that's enough anonymization that I wouldn't care, but not coupled to my medical records.
Yeah, well, however, we have a hand up. Are you comfortable with your genome floating around in a database, Google database, being discussed, used, sold, traded? Who is comfortable with that? 4 wobbly hands, 5. It depends, yeah. But I mean, we do have some ethical things to think through. So, Mariana, how would you see this as a pharmaceutical company? Because you deal with a lot of patient information in your clinical trials. Where do we put the boundary on this?
I mean, this is extremely important. You already mentioned it needs to be anonymized. You cannot be able to connect the data to a patient.
The anonymized is one way, yes.
Exactly. So, I mean, the way to use this data in intelligent ways you use it to generate better clinical trials, to be able to measure the outcome more efficiently in a more perhaps invasive procedures with better biomarkers. That doesn't necessarily need to link with the patient, but more with the data that you obtain from the clinical trials. trials, because at the same time you want to make sure that when you get into a late phase, you have as much data to understand both that it works, but that it's safe. So I think from the ethical consideration, as long as it's separated to the person, is more just the outcome of what it has been measured in the clinics, then it should be. It's what we do every day, not only us, but I think all companies that are running clinical trials.
Absolutely.
But there will be a whole other level of sensitivity. Imagine a surgeon versus a robot. Like, on average, the surgeon is skilled. He's been to KI or Gothenburg for 20 years. But on average, the robot is better. But one time in 1,000, the robot will do something completely crazy and kill the patient on the table. But on average, it's better. Whom would you like to be operated by?
The one I can sue.
Yeah, but as a scientist, right, that's stupid.
Yeah, who would want to be operated by their robot? Yeah, and the human. Okay, and a couple of people who don't want to have any surgery at all. Okay. The self-healers, Jehovah's Witness. Okay, we have. I thought it was a scientific community here. Yeah, it's not. What would you choose yourself?
I think the robot, but I'm not certain. I'm a bit irrational.
But it's interesting this, because I was at Chalmers yesterday, and we had a discussion around the more AI sort of machine learning focused we become, we also need to train our engineers in other topics than the STEM topics.
Definitely.
Because, of course, the questions of morality and ethics and human values. So you agree with this, Fredrika?
Yeah, sure. I mean, it's very relevant to be sure that all this data, especially when it comes to clinical trials, are not possible to connect to people. And yeah, I'm not really close to those kind of application. But
you are a scientist and you reflect on these issues, yes?
Yeah. Yeah.
Chris, how do you protect your patients in this going forward?
We certainly have an ethical committee that reviews our processes and how we consider testing any of our research and development solutions. But yeah, keeping it top of mind is critical. I agree about the anonymity and disassociating the personal identifiable information from the data to get those insights. But it's critical in the life sciences space moving forward to keep this top of mind, because we're moving and evolving so fast that unless we put our own guardrails in place before the governments figure out the regulation, we can make some missteps.
Yeah, because it has been pretty unregulated. That's the thing, and it's grown so quickly. I read about a big meeting in Silicon Valley with now who have gone now from the Democrats to the Republicans, because the Democrats are threatening to regulate the digital space in a harder way. So they were hoping for Trump to be more lenient towards the needs, but there is big discussion around this. Okay, looking forward, we are now here to talk about the two facilities. We've talked about processing capacity of the data coming out. What are you seeing in your fields that connect to these facilities and how they can be used? Can we have a few words for rounding up the session? Erik?
Shortening the loop. What used to take 3 years, we need to get that down to 3 months. So planning the experiments quickly, and like after 3 months, we should be ready for the next round of experiments and have the computer tell us what experiment should we do next.
Yeah, and when will we get there roundly? What are you, next 5 years, next?
I would say long term, which in AI means 3 to 5 years.
And we will get there?
Yes.
Yeah, and you are working to develop such tools.
Oh yes, we're on it.
You're on it, yeah.
I think I see there's still a lot of questions that need to be solved, but we need to be able to learn how to collaborate better, academia, large-scale facilities, and industry, and understand where scientists in each site just with different ways of posing the same question. I think MAX IV is active and it's really, we're working close. I mean, the facilities now will be the challenge for ESS to be able to interact and do the same with the neutrons, so how to, teach the scientists, not only that are classically trained in neutrons, but all of the rest of the scientific community, the value that ESS can also bring into the table.
Yeah, and who, for this collaboration between companies and academia, who should take the driving seat? I mean, who should invite who? How are you seeing that?
Oh, this is an interesting question. I guess, we're in Sweden, and Sweden is very 50-50. I think it's like if you go in a date, you expect everything to be 50-50. I think you will be
you
here.
You split the bill. Yeah.
You split the bill. I think it will be the same. You expect that there will be, maybe it's not 50-50 because there are more than one player, but you expect the large-scale facility to contribute similar as industry and similar as academia. We all want to feel as equal scientific partners in the question.
Ulrika?
Yeah, I'm just echoing what they said. I think there is a lot of room for improvement to speed up, and it would be great to be able to, get the final outcome a bit quicker. But as well, I think we probably need to as well to reflect on training people to be able to judge if what the computer suggests it's meaningful. So I think these two things should continue to go like side by side, having people that actually know how to judge if the outcome is correct or not.
Be like computer inspectors or computer evaluators, or?
Well, kind of making an informed decision. It's, I think it could be good. Yeah.
Chris?
Yeah, I would say recently, we've been very introspective as a business about what we do well versus what other parties could do better than us. And when we look at R&D, we've really determined that the research component of R&D is best suited in academia or government-funded facilities, and that we can take it from there, from the applied technology, and then commercialize it into a product. So really what my organization's looking at now is how do we expand our relationships with academia, with ESS, with...
You talked about collaborations this morning, yeah. What specifically are you looking for? If you do like a little science Tinder here in the group, you send out a little request for dream partner.
Yeah, we've talked disproportionately today about antibacterial surfaces, but I could really have a whole list of technologies and unmet needs in our space about what would benefit the people that use our products every day, both from the comfort of the resins and the plastics, to antimicrobial surfaces, to just next generation solutions that they don't even have to use our products, that we could solve the problem in a more pharmaceutical or interventional way. So it could be its own seminar within itself.
Yeah. So when you work, do you like scientists from academia coming to you with ideas, or are you more kind of on a quest to find them? How does it usually work?
I'd much prefer the former. I don't think today we've structured ourselves and created kind of the strong kind of relationships with outside organizations. So this is kind of a call to the audience to say, let's do more of that. Today, we kind of go out with what looks like our problem statement to trusted partners, and that's a limited group today. In our industry, investigator-sponsored studies are very helpful in taking currently commercialized products and helping us understand and how to market them differently or innovate to the next level. What we need more of in WellSpect and Dentsply Sirona is kind of a structured income of ideas, such and encouraging partners and the innovation beyond our walls.
That's an interesting idea. Is there such a space where ideas that scientists have can be studied by companies if something would fit with what they're doing, like a science Tinder kind of thing? Dating, is there such a place? A matchmaking... Yeah. Okay. Anyone knowing of anything similar? We have a voice over there. Tutti? Sorry, AIM Day. Okay. Yeah. Okay. Cool. There you have more ideas. You know all about this. Maybe you're running this program. So
I can just encourage, I think. Many years ago, when I was a postdoc in Silicon Valley at Stanford, they have this wonderful idea. People from companies show up at random department seminars. You're welcome. There is no entrance fee.
There is no
And that's sure. 9 out of 10 seminars will be worthless, but once in 100 they stumble upon something really interesting, like a search engine.
That's the higher degree than the robot operating the human. Yeah. So excellent. I think we should thank this learned and interesting panel with a warm round of applause. So we have the picture of MAX IV, and next to it is, of course, ESS. Please play the movie, and Helmut up on the stage.
In the midst of the COVID-19 pandemic, science stepped up in an unprecedented way. Researchers worldwide worked tirelessly to understand the virus and develop effective vaccines. Neutron science has been instrumental in understanding interactions at the molecular level, contributing to the safety and effectiveness of medical treatments. Europe has long been at the forefront of life sciences, and the impact of neutron research has been profound. At the heart of this advancement are facilities like the European Spallation Source, or ESS. When completed, this cutting-edge infrastructure will use neutrons to probe the very building blocks of matter, providing unprecedented details. Neutrons, with their ability to penetrate deep into materials without destroying them, are ideal for studying delicate materials.
Neutrons can see the elements that make up life in a unique way, elements like hydrogen, carbon, oxygen. Large-scale facilities provide a powerful tool to tackle challenges in life science. ESS, in steady-state operation, will deliver the highest flux of neutrons as well as scientific infrastructure, and allow new discoveries and information critical to understanding the molecular and cellular basis of modern diseases, as well as drug interactions with cells.
ESS is more than just a facility. It is a user-driven hub of innovation, working closely with the user community to understand their needs and tailor capabilities to support their research. With the European Spallation Source, neutron science is stepping up its game, offering new capabilities that will shape the future of life sciences and beyond.
Thank you. We have Helmut Schober now on stage, Director General of ESS. You're almost like a pattern, a general, you know, commanding like a hugely complex operation. Could you describe some complexities in getting this thing on the ground in Lund? What's involved?
Well, I think the ESS is a European project. That is the first entrance point, I think, to answering your question. And so we have 13 partners.
And it's not the EU, but
it's not the EU, as I always like to say. We have in particular naturally Norway, we have Switzerland, we have the United Kingdom. It's more the continent, it's the cultural Europe that we are talking about. And also from this point of view, we pool an enormous amount of technology from all over Europe. And it's also an area where Europe had the lead, right? I always said when I was a lot younger, studying in the beginning of the 80s, basically in all areas, if you wanted to do cutting edge, you had to go to the US. And I was surprised that when I went to Grenoble, somebody said, this is the place, the best place in the world where you can do this kind of science. And that's actually where the ESS comes in, right? Our aim is really to make sure that also for the next 50 years, this leadership stays in Europe. But the complexity comes from now attracting to Sweden all this know-how. We have 100 institutions we work with, or labs, 40 legal institutions, but it's also an enormous richness to have this.
And they have, these labs have contributed knowledge and technology in kind to ESS, so it's an enormous organizational challenge just making it happen.
It is a challenge, but it's also a huge opportunity. First of all, I have to stress it's not only the in-kind partners, right? That would be way too reductive. We also rely on the full economic tissue of Europe. And just in this context, maybe a remark, if you look at this picture, you were talking about AI and Europe not being at the front. We should not forget the problems, for example, we were facing in the project were often wells. And it's the fact that in standard technology, in standard industry, we are losing know-how in Europe. It goes to other continents, right? And it's just to be compared, the first EPR reactor was very well built according to plan in China, and it struggled enormously in Europe. So also coming back to what was said this morning, it's not a surprise that comes over the last 5 years and not via the Draghi report that we are losing competitiveness. I mean, my generation was talking about that for the last 20 years. So we have to really get our act together. And I think we have talked about timescales. This project took too long, right? I agree, we have to be faster. When we will deal with the data, we have to have a turnaround that is faster from the experiment to the output, because the challenge is out there globally. We are measured with respect to competitors in Japan, in the United States, in China, and we will be measured on the success of our user community. This is the ultimate mission of the ESS, right? To make sure that you here in this audience, the ones at the university, you get this cutting edge competitiveness, and when we discussed, this is terrible word in German, right? Alleinstellungsmerkmal. But it's like
very long word, Helmut.
Dolly Parton said, what does she have that I don't have?
Yeah, the USP, the unique selling point.
The unique selling point, exactly. And I think these facilities that we have here must develop into unique selling points for driving European, Swedish competitiveness and sovereignty.
Yeah. Can we just quickly explain? We see the motorway here going up, coming from the north of Lund. Lund is on the right-hand side. So what are we seeing here, Helmut?
Well, what you are seeing here, we have a long accelerator, 600 meters. This is this tunnel. You see only it's now a green lawn to hide it in the landscape, in the Skåne landscape. This is highly innovative. It has never been built before. At the end of the day, it will produce 5 megawatts of proton beam. So if you're not a physicist, I always say this is just a large number of microwave cavities. Each one has a megawatt or 10 megawatts of input power. So we produce a proton beam. It's shooting at a target wheel. Why are neutrons so expensive? Neutrons are everywhere. I carry 40 kilograms of neutrons with me. Then you can calculate my body weight if you like. But they like to be with protons, so we have to, and this is the process, the fusion process that produces the energy of the sun, so we have to separate them from the protons. So we do that by shooting those protons at tungsten atoms.
And the tungsten target is...
And that is in the middle of that building that has this nice sombrero. And then in there, and I won't go into the details, the neutrons are boiling off the tungsten atoms. They are sent to the instruments that you find in the guide halls, which are these fans that you see next to the central building. And there we do a very simple thing. We just measure for most of the part whether they change direction whether they are absorbed, and if they change direction, whether they keep their speed or not. And we do that for billions of events. We send it to the computer, we understand the process, and out you get the protein structure, the membrane structure, the weld strain in your windmill, your spin structure for your quantum system that may help you to do some quantum computing in the future, and so on. So principle very simple.
Very simple and very expensive.
And very expensive.
This is the most expensive thing in your budget, Katarina, isn't it? Yes, she nods, yes. So why should Sweden spend so much? We are 13 owners, but Sweden has taken the lead, especially in terms of the initial investment. What's the return on investment for Sweden?
Well, for Sweden, I don't want to calculate it at the moment because the head of the council is here, and we know that we have still discussions on how we share the operational costs. But I can tell you that for a facility like the ILL, right, it was always said that France putting €1 into the ILL, €4 come back into the economy. And this is not even taking into account the international visibility that you create with having something like that in your region and developing, therefore, the academic and industrial ecosystem.
So there is like 1 to 4 at ILL, but we could assume it on
could be higher
that
in
magnitude.
Sweden according to how good Sweden is in the negotiations, but the world has also changed. The demands on the host stations are higher, on the hosting state are higher than in the past. So it's also, yes, a lot of return, but also a lot of responsibility for the host state.
Yeah,
to have
so it's up
like
to
that.
Sweden to make sure that this 1 to 3 or 1 to 4 or whatever it is, return on investment is being created in a way.
Well, no, it's up to us all to make sure that this is the flagship facility that we were planning, and that those 3 billion euros that we have invested are really well invested. And it's up to us all to make sure that we get, first of all, for 40 years, outstanding, impactful science out of that facility.
Yeah.
And then naturally, yes, it's also more complicated than that from my experience, because there's a lot, we said, there's a lot of technology coming in. And if Sweden can capture or not capture this influx, right?
Yeah.
So that's then really up to Sweden. To do that.
No,
so it's a more complicated story than just a simple number.
Sure. We talked about the Draghi report. You mentioned it too. You are sort of epitome of what Draghi would like. 13 European countries working together. But in the Draghi report, there was also huge differences because the Nordic countries were doing quite well, especially in terms of measuring productivity, whereas the big problems were in France, Spain, Italy. But you are bringing together this north-south.
Well, we try to bring together the whole of Europe, right, in the bigger context, even the ones that are out of the European Union. We have Spain and Italy on board. The biggest neutron nations, if you like, in Europe is the UK, France, and Germany. But we also have the eastern countries, the Czech Republic, Hungary, Poland, Estonia. So I think we are absolutely doing this job. But we also have to demonstrate that we can do it right. The governance and all this has to work perfectly, so that we are a beacon or a lighthouse that people say, yes. Europe has a lot of advantages because the diversity is a plus, but naturally a centralized competitor, if you like the United States, where you can give that to a federal agency, like the Department of Energy labs, has also advantages in having a lot easier governance structure. So yes, I think we do what is written in the Darja report, because we want to produce this science output that gives us this competitive edge. At the same time, we want to keep strategic technological know-how, and I think this is what Maria Nilsson said this morning, these three pillars, right? The science, but also the technology that goes with it, and to make sure that in Europe in the future we are always capable of building facilities like that, because we master all the technologies, and in the future naturally AI will be part of it. This accelerator can be more efficient with machine learning algorithms that tune. We have 250,000 intelligent units that produce 12 million signals. Right, so you can imagine that it's good if you have a machine that can work 176 hours per week and continuously tune these parameters to the last per mil.
Final question, timeline.
Well, the timeline is that we have made a very strong commitment. We want to hand over the facility to steady state operations at the end of 27. That means with 15 instruments. We then have to go into user operations, and we have to bring all the bits and pieces together, right? Because as I said, there's a lot for the user experience to make it successful, from the smile of the person they meet in the tram, to the reception, to the chemistry labs, to the computer support they get, the experiments that work, the sample environment, the data treatment, and so on. We have to build that up faster than our competitors did in the past. I think that was the message we got this morning. And then we naturally have ambitions to go beyond that, because this should be innovative over its full life cycle, adding instruments, coming to the original plant power of 5 megawatts and so on. So timeline, very clear, 28, we have to deliver, but this is not the end of the story. It's just the beginning of the next race.
Okay. Thank you very much, Helmut, and good luck with the plans.
Thank you very much.
Yeah. So we have arrived to our lunch. Now I need Tutti, some help. When we convene at 1 o'clock for workshop here, in this room. So in 45 minutes we convene here, and the workshop will be around the tables where we are sitting right now. So you return to your seat, and then there will be a workshop. So bon appétit.
So, welcome back. Welcome back. Please take a seat at your tables. men
vad händer på slutet? Ska vi...
Varför finns vi? Du kommer upp.
Ja.
Vad du sett för något som är intressant? Och sen kommer jag bara säga något praktiskt. Och så säger vi... Oklarhet till klarhet.
Ja, just det. Ja. Det var så kul.
Ja, men har ni bestämt var?
Nej, vi har inte riktigt gjort det. Det finns, ja, det blir troligen Lund, men vi vill inte säga det ännu för det är så oklart.
Ja, jag förstår. Men jättebra.
Ja.
Det här gör vi ju nu när allting är klart, så inte nu.
Nej, precis. Utan det ska
typ
vara någon som...
Först nu kommer en genomgång av det här och sen kommer vi ha en panel. Ja. Ja. Bra. Nu drog du. Nu hade jag tänkt fråga henne en grej. Vi börjar bli redo att samla upp alla de tankar som har kommit. Nu ska vi se om Menti kan leverera. Har ni varit inne och tittat på kontrollrummet här? Riktigt medierum. Nu ska vi se. How do you envision your future use of ESS or MAX IV? Får jag fråga kontrollrummet om de kan göra lite större text, eller är det bara jag som är astigmatisk? I'm sorry, in Swedish. Is it possible to... No. Sorry? Okay, you need to submit your ideas. Yes, please submit your ideas. Okay, I will get closer. So here we have a word cloud. Complement neutron X-ray, excellent capabilities, complementary, enabling, protein dynamics, gränsyta, bigger ecosystem, helping us save the world. Very large ambition. Who said that? Okay. Our activist here. How is Helmut going to save the world? A small demand.
Just being himself, I think. No, I don't know.
But what was your thinking behind this?
I think the world is going under, sort of. A lot of wars and stuff, and that we need to do together.
So you will have Helmut and Kalle here as peace negotiators.
No. I think all of us needs to help them.
Okay, cool. We have, let's see. I find the yellow text very hard to see. It's better actually without the glasses. Connecting fund and app. Oh, funding and application, I guess this means. Who said this? Anonymous sender. Education for future use, complementary, preclinical research. That's interesting. It ties into what you talked about. Any comments?
I think it depends, of course, what is the use that the questions that were posed into the ESS and MAX IV. So we need to understand what kind of answers can we get from there. I think we were, new use is what we're trying to learn. What can we exploit these facilities?
Do you feel you still need help in terms of sharpening your questions?
Yes, but even though, we're experienced users in AstraZeneca, but we still need help sharpening the question, or we're also in the stage that we might want to have more advanced environments so we can actually answer the questions, so how we can work together to get, new ways of measuring that will actually answer what this complex material or systems are telling us.
Let's see what else we have. Let's do drug formulation, an actual drug formulation. Who said that? Wow, we have a lot of ghosts in here actually sending in stuff. Nobody's responsible for anything. It's like the only one who wants to be responsible is our world peace guy. Okay. Yeah, okay. Okay, I think we go to the next one. What should the facilities provide to be relevant for you? Industrial cheap access. Who said this? Yeah, now we have a sender. Perfect, I love this.
So, I come from the industry world a little bit in between. I'm from institute, so as I see is that industrial users have to pay, but a lot of industry don't know what they can get out of it. So it should be an easier access, it should be a bit cheaper access to begin with at least, so that they can test and try, and in the future when they know the value, they should be able to pay.
So you want like an initial price reduction as a kind of tester fee? Is that what you want to see?
Yeah, to begin with, at least, so that we provide value for Swedish industry.
Let's take this question to Charlie. You have a demand for very cheap entry fees to the facilities from industry.
We're already too cheap. Really, we are much too cheap.
Compared to what?
Compared to what it actually is worth.
Okay. Yeah. So who is setting the price? Because this is not like a clear market, is it?
Well, the price model is very simple and simple-minded. We take the total amount of hours we provide to users, and we divide our operation budget with that total number of hours we provide. And we don't take into account investments, we don't take into account that it's very different between different experiments and so on. So we end up at a price tag which is below 800 euros per hour, which I think is nonsense in reality.
But that's a strange way of calculating a price, because the worse you perform, the fewer users you will have, and the more expensive it'll be for those users who are around.
Can you say that again?
Well, if you divide your operating cost with the amount of users, so if you have 100 users, it's one price, but if you only have one user left, your most loyal client is going to be super expensive for that.
No, the total amount of user hours we provide, so which is a very big number. We're talking 50,000 hours.
Yeah. So 800 euros per hour, is that a reasonable entry fee?
Well, first I would say that you say it's cheap for the value, but not all sectors in industry know the value before they have tested. And the way we translate the full experiment is not exactly per hour like that. So they come up with a problem, we translate that, we need to do measurement for this fee, we need to do analysis for this fee, we need to plan for this fee, and at the end it becomes one experiment between 500,000 to 1 million to actually get to a result, let's say. If you're paying 1 day beam time, if you're paying people to do the experiment, to do the analysis, let's say for a successful experiment, that's a price kind of where it lands for industry. Do they actually directly see that value before they have tested? So it's good if they have this easier entry, first time, second time, to get that.
Like a gym membership, Charlie. First time is free. Yeah, a drug dealer, yeah. Drug dealer or a gym club owner. Is this a good comparison? Helmut, can you have some free introductory sessions?
Well, I think this is happening all the time, right? From my experience, when we did that at the ILL, if people came with a pilot study, we always were open to do that in collaboration. I mean, the question is, do you want to promise a certain result and then only pay when the result comes in? The calculation you brought up, the problem is, I think the dominating part is not the fee for the experiment, right? And you will have to do the rest of the work in any case. So whether Charlie now goes down way below the cost of a New York lawyer, 800 euros is what a New York lawyer costs per hour. That won't change the $500,000 drastically, because you still have to grow your crystals, you have to prepare your experiments. And that brings me back to the role of the public funding that was mentioned this morning, and why probably the best way to start that is through academia, through the universities, to do these pilots in this, because then basically what's happened is that we are, or somebody else is exactly paying for these pilot studies, right? I don't see another way. ESS could not, and I think MAX IV neither, put $500,000 on the table and said, this looks like a good project, let's try it out, let's put a couple of postdocs on it and grow samples. But there is ways to do it.
But couldn't you offer like a free session, Christmas night, you know? Yeah, okay. Could we have...
Yeah, I mean, I think we have to be absolutely clear. Most industry access to these facilities is free, right? It's free, and it, either directly, an industry can apply like anybody else academically and get free time, right? So there's already, that's most of the use is free. The paid use is a very small amount, and you're getting that because you're either getting a specific service or you're leapfrogging the queue. You're going above everybody else. So that's what you're paying for. Right, you're not paying for the entire cost of the operation. Just say, don't give leapfrogging to industry for free. If you take the example of the J-Park facility, the Japanese neutron facility, they had a lot of programs of giving beam time to industry. Just come and use us, just come and use us, do experiments. And they've been doing that for 10 years. There is almost no visible output because the industry can try something for free and it doesn't work, but doesn't matter, I didn't pay for it, it didn't cost me anything. Don't do that, right? So free industry access just because industry is good is not a thing to do.
Okay, it's interesting. We have clear different opinions here. We have, it should be cheaper. It's and when you see free, it's done with academic partners. That's what you mean.
Industries can apply to facilities as an industry. You don't have to be academic, but you go through the same system as academic partners.
Yeah. Understand. Charlie? Hang on.
I think it's basically been said already, but of course, industry can apply as long as they commit to also publish the data. If they want to own the data, they have to pay. So I think it's a very fair model. And again, I stand by the statement, the fraction of cost that we infer by charging 800 euro per hour is virtually nothing. I stand by that. It should be 10 times more expensive, sorry.
Okay, you will get a comment. We have more opinions.
Just to add to this, I think it's not quite just industry that are put off by some of the cost. It's also something that's delaying doing the science that people in industry want to get on and do something, and so they want an access method that allows them to get in when you've told them that it's exciting. They don't want to wait 6 months for the proposal and so on, and that's the real barrier to getting things done, and that applies to other users as well.
So what you're saying is that the free access comes with a flip side, which is the long application process, etc. Is that what you mean?
That's for everybody.
And that's for everybody. Okay.
Magnus Larsson, user office and industry office at MAX IV. That's also why we are trying new access modes. We're trying a feasibility test where you can come in faster on many of our beamlines, and also other ways of coming in on a shorter notice to test whatever is possible first, and then you can send in a full application later.
Okay.
Thank you. Niklas Rice here. I think the Vinnova pilot and development project has been very good for collaboration between industry and institutes and academia to see what you can do with these techniques and so on. So I would like to encourage Vinnova to continue with that.
Okay, I think Shirin, you need to, because you raised this issue, are you getting the answers that you want, so to say?
Yes and no. As you said, exactly, maybe the measurement price per hour is not the big issue. Maybe what I meant by cheap access to industry is helping industry through the whole value to get actually what they want, not just to get the data they don't know what to do with. And in overall, that is very hard to get at the moment from many facilities. I can't say every instrument at each facility. That is one thing, and in general, if that is easier when they can see the full demo case, then maybe that would promote more user in the industrial user. But the second thing is basically the access that you mentioned. Yes, industry is allowed to apply through the same path. But what I have seen, at least from a representative from Institute, is that a lot of research we do, a lot of experiments we do, sometimes we're not allowed to publish, and that leaves us behind publication compared to academia. And that makes it really hard for us to compete with academic access. So it should be a little bit of a different priority when it comes to industrial access, even for the free academic use. So for us, it's a bit hard to try new methods or develop things because we don't have as many publications, and we probably won't have.
Okay, I think this is a contentious issue, turns to be in the room. So I think we do a hand up. Shirin, is she right? Is it too expensive and too complicated to access? Who supports Shirin? At her table. The table stands up. Couple of women. You have female solidarity here. Also, gentlemen, some more, yeah. For neutrons, okay, photons are better, or? X-rays are okay, so complex answer there. And who agrees with Charlie that this is a New York lawyer price level, this is where we should be, and anyhow it could be for free if you apply? Who agrees with that? You pulled your hand up for both. Okay, because?
Because you said it was too complicated and costly, and it's the combination that makes it's the complication together with the cost that makes or limits the industrial access. So if we take another Swedish facility, the Petra 3 Swedish Material Science beamline, a third of the users there are actually industry, but they've reduced the complexity and cost by getting access via competence centres and cloud universities. So it's another model within the Swedish system to get access.
Okay, we have many voices here from KTH. What are you thinking?
I guess it feels like there's a couple of different questions here. So one is the actual price
for beam time to go and collect your data, and that's been argued for. But really, sort of, what can Sweden do to strengthen going from start to finish? Can we have projects where we've had the Vinnova pilot projects, and they were for 1 year, and that was enough funding for 1 beam time, maybe 2 if you were lucky. But what are the next steps? So are there ways to support these kinds of experiments? It's not necessarily for the facilities or the infrastructures to solve these individual questions, like what can the Swedish community do, or the funding bodies, to enable these kinds of projects?
So you're kind of sending the complexity up to another entity. And what could this entity be that fixes this intersection?
I mean, there could be projects that are driven from universities in collaboration with industry. There could be projects that are driven by industry in collaboration with universities. There could be consortia, for example, between industry and academia to try and look at some of these things.
Is the discussion settled? Will we have some severe fighting outside afterwards? Yes. Who said yes? Okay. Okay. We have, let's say, practically accessible workstations for data evaluation. Yeah, the data evaluation aspect. Who talked about this? We have talked about it extensively in the morning. Workstations for data evaluation. You said that. Okay. I will leap backwards here.
Yeah. Oh, sorry for sitting so far away from you. No, I wrote that because I do a lot of X-ray tomography, and I experienced that then you easily end up with many terabytes of data, and often I log in from outside to the facilities and do a lot of reconstruction afterwards, but it could be really time-consuming, and in a way you often get second priority in the list of the work in the cluster and so on. So sometimes I think it would be nice to just have a place to sit there maybe 1 or 2 days after you have had your beam time and make everything ready. And then I can go on to the next step after that.
Like a post-operative kind of surgery department at the hospital?
Yeah, in principle, yeah, just somewhere to sit with access to the cluster, continue the evaluation of the data.
That should be easy to fix, Charlie and Helmut. Somewhere to sit and process your data. Hang on, Helmut, you're planning right now. You can build a room for this.
Well, we did it. This is integral part of the DMSC, and we very often we even have those data scientists, right, that we have there. So it's fully integrated into the strategy. You just have to go maybe over the bridge, or you have to bring your data scientist over the bridge to sit with you in room at ESS. But it's part of what we are planning.
Okay, industrial cheap access. Another time we had that. Easy access, again, the access thing, practically accessible. I mean, it comes again and again, which is interesting. Transparency. Who said this, and what is meant by transparent? Who should be transparent about what? So the one who wanted transparency is now hiding, which is very interesting. Okay, yeah. Anonymous person? Yeah, okay. Let's look at the next question. Is this the next? Yes. What do you lack to be able to conduct research or R&D at large-scale research facilities? Somebody lacks sustainability in what? Their own work or their own energy or the facilities? Who said sustainability and what? No one. Okay. Interesting. Somebody who lacks competence. Who's talked about this? Pia lacked competence. Yeah.
No, it wasn't so much that we lack it, but it's important to have competence and to build competence to be able to conduct research or R&D. And sometimes you like it, and sometimes you need to find it. So we just put it up as one very important part when it comes to be able to use this kind of facilities.
We also have another cost question. Travel grants for do you understand Sweden or? In Sweden, yeah, travel grants in Sweden. I've heard that with student groups. Daniel, you and I have talked about the students groups who want to go down from the other universities. This is lacking. Was it you who said this?
No, we said it. Yes.
You said it.
No,
yeah?
we said it, not me.
Okay, but you are now the spokesperson.
No, we know that there are opportunities to make experiments as a Swedish university in other countries and get travel grants for going there, staying there, and that does not exist to go to Lund.
Katarina, is this a good idea? Travel grants? Is Vinnova in the travel business?
Yeah, maybe. I'm not quite sure if that's the best way to put the money, but it is a factor that is hindering, I think, a Swedish participant at this site. So something to consider at least.
Especially when you have larger groups of students, yeah. How is this financed now if you want to go with a group of students?
Yeah, university.
The university funding, yeah. Okay, let's see. More Vinnova funding. Okay, Vinnova has left. She cannot answer. What type of funding specifically from Vinnova? For what? Who said this? We now have a sender. Perfect. We now have a sender.
Right, Joachim Schnart, Interim Science Director of MAX IV. It actually was up before. It is the pilot project funding from Vinnova that we've been having before. And we've just been saying that it has been a very good action to do that, and we would like to see more of that.
Maybe it also ties into what you were talking about, Shirin. It's a similar kind of thinking. Okay, one last word. Data analysis, we have talked about travel and hotel funding, which is exactly body and material mus. What does this mean? Muscle? Anybody recognize this word? No, okay, a lot of anonymous stuff. Success stories. Yeah, you were here, okay. Tell me.
It's about a biobank, having access of the biomaterial at one place where currently we lack in the R&D sectors, where we have to collaborate with the clinicians and different hospitals from around the world and get the material. And that takes much of time and effort. So having this in a big R&D facilities makes easier for the researchers to conduct research and save a lot of time.
We had the success stories also, where you are easily can be inspired and understand in a more practical sense what can be done. What type of success stories are you talking about specifically?
I think it was me. Hi, I'm Malin Burstedt from RISE, and when we work with small and medium-sized industry companies, they don't actually understand what they gain from these really, really nice techniques. And when we start to show them with, for example, Vinnova projects, which has been excellent, when they understand what they gain from working with these facilities, they think it's great and they want to do more.
It's, as we have seen it, it's mostly the big companies that understands it up and now.
Can you give some examples of success stories that you have shown to smaller companies? What are we talking about specifically? Could you give some concrete examples?
I think we have to publish it first. Okay. No, but when we publish it, we will try to communicate it better than we have. This part of what RISE should do, I think, actually.
Excellent. So you have seen in real life how inspirational success stories can be. And of course, smaller companies have less of a competence in terms of having specialists to use these facilities. Okay. Vinnova project is good. We already talked about that. Was this the last question? Did we have a fourth question? No? Okay. Is there anything of vital importance apart from world peace that we haven't mentioned? All ground is covered. Excellently. We will then swiftly move into our next panel, our final panel. And I would like to call up on stage Pia Kinhult, Oliver Bjelke, Selma Maric, and Jon Sporring. Give them an applause, please. And as we talked about in your thought process here, we talked about the bottlenecks, started thinking about that. And it's very interesting. A couple of weeks ago, there was a report published where a deeper analysis has been made on the bottlenecks of using the facilities. So we look at some of those bottlenecks in a very practical way and discuss strategies to overcome those impediments. Before we go through that, I'd like the panel just say hello. Who are you? What do you work with? Please.
All right. My name is Jon Sporring. I'm a computer scientist from University of Copenhagen, and I've also for many years worked in our center, which we call Defined Images from MAX IV, which was or is designed to explore the space of helping scientists that produce images at these large facilities, that they actually turn these particular pixels into knowledge.
Yes, Selma Maric. I think most of the people here know me from MAX IV, and I stood in this meeting last year in Luleå representing an initiative called Spirit, which used to also be called the Technical Park Function. And today we have a new name, ARI for Sweden, which stands for Advanced Research Infrastructure in Industry and Innovation Sweden. So that 4 is supposed to be an exponential, because we think that joining facilities, industry, and academia together, we can be exponentially better at solving challenges. But it has changed since last year, and I want to take that up. Last year, I made you all stand up, and I would like to do that today as well. So we have industry with us, with Tetra Pak, stand up, Eskil, and we have AstraZeneca, we have IKEA, Linda. We also have universities with Umeå and Stockholm and Luleå, and there are many more, but these are the ones who are here. And Sverim, of course, an institute. So we have, in this, thank you, you can all come and talk to us later, but we started this new phase in May this year, with a new phase of Spirit that is now called ARI, and we are developing ways for new collaboration between industry, academia, and the facilities to be able to tackle some of these barriers and build competence within that.
Thank you, Selma. Yeah, my name is Oliver Bjelke. I'm a professor and malaria researcher at Umeå University. I'm not a user of MAX IV or of neutrons, so I'll find it hard to comment on specific bottlenecks here. I'm associated with 2 other items on the VR budget, and one's the much smaller items, I hasten to add. One is the European Molecular Biology Laboratory, which I find inspiring as an example of European research cooperation. And the other is the institute that I lead, which is the Swedish EMBL node, Molecular Infection Medicine Sweden. And our task is to promote excellence in infection research. We do that through hiring group leaders. Emmanuelle Charpentier did her CRISPR research at MIMS. And then we aim to leverage our link to the EMBL network for the benefit of Swedish research more generally.
What did you think about the malaria mosquito, or the mosquito infected with malaria that we saw earlier on in Jan's presentation?
Yeah, I loved that. My
You
lab
love
is going
it,
to
yeah.
now move towards actually studying these cysts.
Yeah.
And this is exactly the kind of inspirational example of using a facility like that, which will get me going and using it. Yeah.
Being a malaria expert, what did you think when you saw that image? Was there anything in it that surprised you?
I was absolutely stunned by the possibility to get this comprehensive picture of how a parasite interacts with its mosquito. Now, of course, I would immediately like to see that in different species, get at the fine detail of the interaction, do experiments, use it as a readout of experiments.
So this is a practical examples of success stories. Is Jan here?
Yeah.
Yes, sitting there. He likes your video. Okay. Last but not least,
Yes,
Pia
Kinhult, and I'm working at the European Spallation Source, mainly as head of host states relations, taking care of trying to support our directors with our 2 host countries, as we have both Sweden and Denmark.
Pia, you are also one of the authors, one of the 4 authors. Daniel was part of it too, sitting here.
Yeah. Daniel and Kajsa. But I don't think Monica is here.
No,
yes.
Monica met yesterday, actually, and this very interesting report about the bottlenecks. So if you would do, we had an elevator, you and I, to the 10th floor. I was like, bottlenecks, are there any bottlenecks? What would you tell me?
I would tell you, to begin with, I need to say that this is not published yet. We are not finished yet with the report. And I'm very grateful for my dear colleagues like Daniel and Kajsa and Monica Ringvik from RISE at the time, she is now Chalmers, to have been helping us, and also Tutti and Maja Helsing from the Research Council helping us actually doing this work. And also to underline that this is not a full report on all the bottlenecks in the world when it comes to this work. It's not either a scientific paper, it's actually just trying to list what we know today with the input from different kind of actors in the system, the university, and thank you so much for all the input we have got, both by asking people directly, but also sending it around and getting a lot of input. So this is just the first try to list the bottlenecks that we know and are much aware, and try also to prioritize between them to see where should we start trying to solve them. It's not full, it's not complete, it's just to also start the work with actually trying to handle this. And mainly, the question that we have talked about all day today, data, computing, analysis, visualization, that part is, we would say, I would say, and I think we agree in the group, is the biggest bottleneck right now. In all different kind of aspects, when it comes to both capacity, storage, ability to analyze, methods, etc. That is really the big one that sort of really takes over, I would say. After that, we have been discussing about sort of the competence research schools, the way of trying to get this, learning the techniques into the normal systems. So that I would say maybe is the second one, the second bottleneck. And the third would be the ability to actually work with collaboration and build consortia, like now Selma and the group is doing in RFO Sweden, that kind of instruments in way of creating consortia to actually be able to bring the techniques into a bigger and broader use. And then there are several others, but you can read the report soon. It's not published yet.
I read it. It's
soon
actually,
in a bookstore close to you.
Yeah, and it's easy to read. A good.
I hope so.
Yeah,
I hope so.
A good read. So if we start looking for solutions, before we do that, who are the stakeholders that can fix things? Who are they in the system?
Well,
maybe you or Selma. Yeah. Who can you point to? Your responsibility.
Who are they?
I think I want to cite Darja, what she said this morning. It takes a village to do this. I got to read the report, and I think it was very good, and I think we need more of these, and really. So I just, a little bit now that we are working together, industry, academia, facilities, and we've started with a mapping of everything that is going on. There is so much going on, and we have done quite a lot. I think first time I came to one of these meetings, a lot of things has happened. How can we then bring people together to really leverage on everything that is going on? So one of the things I want to point out that we now see when we work together in this new way, and I want to mention some people like Eskil here and Mariana and Nils in Umeå. These are very, and also something that comes through in the report. What the users need is a certain type of competence, and there is one section that I want to take up, which is about relationships. And for those of us who have, kind of like Federica, grown up at the facilities, we know that it is about the competence and the relationships that you build with these people between different fields, and we kind of call them boundary spanners, knowledge transformers, that can be either in academia or in industry. It's not really relevant, but them working together, I think that is a key. And I want to take up this, the pilot projects that Vinnova financed. I think there were about 100, and 80 of those, there were 80 companies involved in these pilot projects. There is a handful of individuals that is on all those projects. And those are these boundary spanners and knowledge transformers. And I think we need a lot more of those. And additionally, relevant instruments where we can also standardize that are relevant for industrial and other challenges. And I haven't even come to the clinicians, but we can take that later. But I think all of those things in parallel need to be invested in. Yes.
I'm full of respect for people who are like informal leaders and sit on a lot of competence. But when responsibilities are not clear, they are very hard to penetrate for new people. Because you just need to be old in the system to know, yeah, you should talk to this guy who's sitting up on the second floor. So how do we, with respect, people who have competence, make a very clear system that is easy? If Shirin comes, she knows exactly, this is the person I talk to, this is who I enter. How do we make clarity?
Is it okay?
Anyone who wants to grab.
I can grab it. I mean, there are many ways of doing that. I would like to actually flag for one organization that is coming from Lund, which is the Links Institute of Advanced Neutron and X-ray Science, which is quite a small organization, but has built a huge international network where people can just join different activities and start doing that, where things can happen on their own even. So I think we need to build up more of these types of environments where we focus around challenges together.
Okay. Malaria professor here. Let's say you wanna dig even deeper into the fly that carries the malaria. And do you know where to enter this system right now?
I would enter this sort of system like perhaps an industrial user through a collaboration. I wouldn't enter it myself. And I think that's true for many of the scientists around me. And it's the experts in the field who need to have the detailed information how to access the system. It needs the amateurs like me who need to be inspired how to use the technologies. So I'm really looking forward to be inspired what we can do with neutrons.
But you have seen the video now. You are inspired. He's looking for a partner.
Yeah, but see, this is exactly how it works. Right? This is why it's beneficial to be part of a broad scientific network that exposes us to a broad range of science outside of our discipline and gives us the ideas of how we can use cutting-edge technologies.
But isn't that easier said than done? Because, I mean, I I still think that this is a little bit traditionally quite a small private club for only members, and what we need is to actually open the doors and broaden ourselves, both from the inside of the facilities but also from the community that is already sort of competent to use the facilities. It has been kept as a secret club for a long time, actually, and now we have the pressure to actually not be so private any longer because of the cost of these facilities. It needs to be used by more people, and it needs to be sort of, you need to feel the use for a broader audience. But I think you're right. The thing is, where do we find those environments where you can go and you can find this that is actually broadening your range of knowledge?
I completely get your club criticism, because in my previous life I worked at the Wellcome Sanger Institute, which is heavily technology driven, and you could put basic scientists working on a problem like cancer next to super cutting edge technologies, but then it's very hard to make this accessible to a broad community. So that's perhaps not a solution.
Or somewhere in between, maybe.
But yeah, exactly. So where is the solution in between, right?
Yeah.
And you know, if I look at so like whatever, Germany and France, when they built their synchrotrons, put an EMBO site next to them to as a separate institution, but helping develop the technology and create inspirational science. So perhaps you want to recruit a professor in neutrons in the life sciences to Lund University and just have a really good scientist there who can help spread the word, inspire other people. You know.
Yeah, I'm interested in the data processing and data imaging. Jon, why is this so difficult?
So before, I have a comment to the previous discussion, if I may first. I think, as Pia was saying, the data analysis is a huge bottleneck. It's easy in some sense, it's easy to spend money on hardware, but as soon as it becomes the post-processing and the spending on people staring at computers, that's for some reason more difficult. And the experience that we have through our center now for, I don't know, 8 years is that people like me, so I'm a professor in computer science, I engage myself in the stuff that I think there's at least some chance that it'll be a research question for me. But the more regular stuff is simply not something I can do. I mean, it's on the level of teaching, and okay, if I might be able to make an agreement with my head of department that it counts as my otherwise teaching duties. But I think we have to realize that we need to invest in not only beamline scientists, but also the post data scientist in some way. And we're trying to experiment with this in KIM, but also in the European and all the national microscope communities. And I think there's a structure slowly crystallizing, but it costs money. And these are difficult money to get. And so that's, I think, is an important point. Now, if you're ready for the answer, the other question you asked.
Yeah, I'm data imaging, first data processing and then imaging. Why is this so complex? Why does it have to cost so much? What is the quality of the work that's being done into that, and what quality can it provide?
Yeah. So I'm slightly biased because I look at images, three-dimensional images, or maybe even higher-dimensional images. So to me, it's there's this process of taking these pixels or voxels and identifying objects or structures in these images. And these days we are all using AI, which basically means that for 10, 15 years we used third-degree polynomials. Now we're using models that have billions of parameters. And that means that where before the fitting problem was simple, because how many data do you need to fit 4 parameters? Now we need to be sure we have lots of examples. This is one of the big problems in analyzing images like what is coming out of MAX IV and in the future ESS. That is, someone has to sit down and teach these machines what it is it's going to find for us. This takes an enormous amount of time. It's not something you necessarily just can delegate to one of my students, because they won't know what's the right thing to look for. Right? This requires expert input. So even though they look like wonderful black boxes that solves all the world problems, there's lots of work there. And this is one of the things that cost money. The other problem that we have in this community here is, as opposed to the medical community, where there are lots of CT images of lungs, and there's cohorts of patients that are ill or healthy, and you can do all kinds of wonderful statistical analysis of this. Here we typically have few cases, so it's case-based research. So I think understanding that even though you might have sampled, these sample sizes are getting really, really big in the sense of how many pixels, but it is still going to be, one mosquito, or maybe if you're lucky, 5, but then you're really lucky, right? And how can you conclude anything from this? And so my view on that is that it's extremely important that we build a close relation between these large-scale facilities and all the small-scale facilities that are in the basements here and there. I mean, we must understand the relation, because otherwise it's just going to be case studies. It's not going to be science on the large.
But can I ask you here, thank you, very interesting, the 3 months to prepare, the 1 day to do, and the 3 years to analyze, yes. Can we shorten that? I mean, you're talking about instructing the system, so what it should look for. I mean, if you have AI, it will start to learn eventually what it should look for.
It's, yes and no. The thing about case-based analysis is that every time someone comes in a new material or they tweak the machine a bit, the images just look different. And these AIs are very sensitive to this. But in our work, we're trying to help. We call them users. I think we should call them researchers, etc. But we're also researchers, and it becomes a little bit confusing. So we just call them users. We've in the work with MAX IV and all the other facilities, and also the small facilities, there seem to be like 3 levels of data science support that is used. The first is sort of like consultation. So you're welcome to call me tomorrow and ask me about questions about what I think might be useful to discover in your images. I will happily give you, my thoughts on this. So that's one level. Then there's the other level, which is just standard methods. And these standard methods, they're slowly, becoming well understood, etc., including some of them are AI, but not all. And then there's the ones that gets my little research heart beating, and those are the ones where we need to together figure out completely new ways of doing things.
Could you give an example of what that could be? If somebody, what's the dream project turning up at your door?
There are many. So I work with geometry and topology and statistics, and presently my dream project is understanding how we can use topological measures to do statistical analysis of data. So that could be paper fibers with Stephen Hall, figure out what is it, this interaction that paper fibers have that actually makes the strength of this. But there's
you have Tetra Pak here. Yes.
Yes, and I think we've looked perhaps at some of their paper. But anyway, so that kind of thing.
Yeah. Well, so these very interesting thoughts on data analysis.
Can I add with the data and the standardization? I think this is really important, and also not just for the imaging, but also other techniques. We heard a lot about the formulation and the lipid nanoparticle and SACs and things like that, where we could actually start becoming better at standardizing. And I would like to see a future where we don't just map a concentration of the biomarkers when we go to the doctor, but you can actually couple it to the structure, and then you can get more what we discussed this morning. I think this is doable, but it takes a lot of investment in doing that enabling that.
And would it be, shareable between users, the standard models? I mean, would they be proprietary, or how do you see that?
That's a very good question, and also takes us into the clinics. Most of the models currently are developed by the academia, I would say. I don't know if Mariana is agreeing with me on the bioscience side, but I think it's something we need to explore.
Oliver, any thoughts on the data imaging?
No, it's not data I work with. We work with other type of data.
Yeah, but you will be maybe in a couple of years' time.
I doubt that I personally will have the depth of insight to do that.
Yeah, but you will have people like Jon.
Exactly.
Yeah.
Sure.
So what could you win by teaming up with somebody maybe like ESS MAX IV and Jon? What could you envision?
I would rely on collaborators who can provide the deep analysis of the data, and I would put in the biology and the science.
You will put in the 4 other mosquitoes. We already have one. We need a couple more to start getting some more data.
Well, don't underestimate how many mosquitoes we can produce. We're good at that.
You're good at that.
We do that at scale.
How do you catch the mosquitoes? That's interesting.
You know these little insect guns that your children have?
Okay, they're fairly good. Yeah, fairly good. Pia,
but I think we already have 2, because I think MAX IV has their own fly, don't you? Even if it's not a mosquito fly, it's another kind of fly, isn't it? Yeah. So we have 2 at least.
2 at least. Yeah, exactly. So Pia, we talked about data analysis and maybe ESS providing space for people to sit and work with this. What are your thoughts?
No, but I mean, as Helmut said, this is already sort of in our strategy and in our plan. So it's only, in a way, it's surprising, because we've been doing what we today call machine learning since, I think, end 70s, beginning of 80s, and it seems like we haven't really moved that fast when it comes to, except for certain actors. But in this system, we haven't really followed what has happened. So I think for us, taking in the AI now that we are now doing is extremely important, so we are prepared when opening for what is happening it will happen a lot in these years we have left around us. So that's more, I think we have in the strategy, we have data management centers, so we are well prepared, but of course the challenge to keep up with the pace is of course a challenge.
So I was looking through the list of the many interesting recommendations in the report that need to be built in order to facilitate access. But then I was became a bit thoughtful, because sort of the facilitator to make a lot of things happen was like the government in 9 out of 10 cases. And I was thinking of the poor overworked Secretary of State, Maria Nilsson, like, okay, this is going to end up on...
She carried the full responsibility for everything.
Yeah. So
I think we actually have changed that.
Yeah, because I was thinking you're sending a lot of problems up the pipeline, so to say, to the top floor. What can be done at a kind of lower, more operational level?
Quite a lot can be done at the operational level. I think we have actually taken away but then, of course, at the end of the day, it's a value chain. So even if the facility can solve some of the bottlenecks, maybe the facility needs to get that kind of assignment and funding from our owners. And who is the owner? That's the states. Or in our case, it's the states. And in MAX IV case, it's the state. So, I mean, it depends also how you're looking at this. But at the same time, we have actually brought down most of the recommendations to actually the actors. But then there are things like this with the... we have a problem in the future for Sweden when in accordance to ESS, because we cannot second people from other universities in the other part of the country because of rules for the authorities that the universities are. That needs to be a law change. So then we're back to the parliament and the government. So it depends also on the bottleneck, of course.
So we are about to round off, but I'd like to give the floor to each one of you. What do you see within the next 5 years in terms of continuing making the usage of MAX IV a success, and as ESS starts with its first science, making that a success, seeing the sort of bottlenecks melting away. What would you like to see, Pia?
Well, to start, a little thing that we actually discussed at the table, to see more of a joint force between the facilities up here in the north when it comes to handling, analysis, etc. Things that are very expensive. It's not always relevant to do it together, but when it's relevant to do it together, that we actually join forces, because then we can be a bit more efficient, use the money and get to the results maybe quicker, or the answers maybe quicker. That could be one thing that we discussed when it comes to that extremely big bottleneck that I think we need to focus on.
Selma?
Yes, well, I discussed a little bit, and it was the first time we met with Robert, who, when he was a user, not Robert Weidenhauser, Robert McGreevy, who, when he was a user, he had to build his own instrument, and then in my generation, I focused on one technique, and we were just doing that technique, and now we're seeing we want to broaden this, and we have users that don't really care about the technique, they just want to get the data, right? How do we... I would like to see much more of these boundary spanners, wherever they may be. It doesn't really matter if they're in industry, academia, or at the facility, but that we can invest in that type of competence that can bridge this, and competence program that can allow for that. And environments where this can happen and we can join around common challenges. So I'm pushing for ARI for Sweden, obviously.
Well, I've got perhaps two comments left on my mind. Before I came here, I did a little straw poll among our crystallographers just to see what their thinking was, and I felt that there wasn't a particular loyalty to using a Swedish facility for their work, right? There seems to be very much a European market, and people are very pragmatic as to where they go. So what I was looking out for today was to find what are the unique selling points of individual facilities that might be promoted and attract certain users and really push the limits of what can be done. So I wonder just how much of that exists and how much of that discussion is ongoing. And the second point is just from
you want to see a clearer sales pitch.
Yeah, I'm naive, right? I'm just reporting an observation here that there seems to be a big market.
You got so a dead mosquito today, it wasn't enough.
That was a good sales pitch.
It was good.
I go to Hamburg, right? Yeah. So, see, you know, no, this is, no, seriously, this is something I thought could be useful, and the unique selling point argument was mentioned previously. And then this is also how we approach infrastructure collaboration through our partnership, that we often try infrastructures in our partner universities in Helsinki and Oslo and Aarhus and Umeå to jointly run workshops and work out, not only train the next generation of users, but also work out between themselves what they learn from each other, what their unique selling points are, how they can point people around. Perhaps this is also something that can be considered at the level of collaboration between facilities.
And Jon, from your perspective, data imaging.
Yeah, I think I have two dreams. So working with, among others, biologists and trying to encourage them to use these facilities, it's clear that maybe it's just a mental barrier of actually engaging yourself as community is really high, and so we need to work hard on the entrance level. I think shortening the time and doing feasibility studies in some simple way is a key way to do it. And the other thing is I'm happy that for the first time now our center is a little check mark at the application for beam time at Denmark, and that we develop this into a sustainable data science support structure for all the beautiful images, that we actually make sure the science behind it actually gets out of these images. So that's my dream.
And I guess if we're looking for inspirational stories, this will be part of the communication too afterwards.
Yeah.
Yeah.
Can just add on to that, because we're all with the clinicians, right? And we talked about this cost of beam time, which is the low. I mean, we are half the price of PSI Max IV, so it's not at all expensive, and it's not really that what costs. For a clinician, they cannot wait a year and a half to apply for beam time and then they don't have the funding to pay things. So I think we need to look into different policies for those types of researchers coming in. If this is going to work.
Okay, I want to thank this. This was the last panel of the day. I think we give them a good round of applause.
Thank you.
We've had an excellent group of panelists here sharing expertise in many different areas at the intersection of life science, AI, computational science, and high energy physics, and also from the corporate world. And I think it's been super instructive. I think we should round this off. Katarina Bjelke, Swedish Research Council, who is our host, one of our two hosts today. I have learned a lot. What have you learned, seen, heard today?
Well, I think, I mean, my background is in medicine and life science, and I think it's been a fantastic day. I've learned a lot, I heard a lot. It started a lot of thinking about, not least how we act as funders of this area also. What can we do? How can we be better at listening to the needs and then the barriers? I would like to focus, of course, of the possibilities, because that is what's really interesting. So it's been, I think, a fantastic day in a fantastic area also that I must say probably inspires people who are working in this area. So yeah. And I would like to emphasize one thing maybe that I heard during the day in many ways, and that is that people go where excellence is, and industry goes where the excellent people are. And in order for Sweden to be competitive, I think that we need to have these top-class facilities. They need to be among the very, very best in the world in order for us to attract those people and this really great science and innovation. So that is something I've been thinking about.
I was thinking, because I've been moderating this now the third year, and I think there is like a graduation in terms of the depth of engagement and knowledge of what, each year we become more and more clear about the issues at hand, and also the facility. At the beginning it was like, what are they, how is this being used? Now we're beaming in like a little high energy particle on exactly what needs to be fixed. It's interesting to see. So I'm thinking in terms of what pressure, because you have to report to the minister.
Yes.
What pressure do you have on you in terms of creating value for Sweden with these facilities? What are you hearing?
Well, a lot. They are expecting a lot of these facilities and a lot of what comes out of them. Oh, I have someone. A lot of what will really come out of this and what Sweden will gain for engaging so very much money into these facilities is actually. So it's really, it's really a need for scientists, for industry to become aware of the possibilities and to really, really use the facilities. So that's, I think, what they will demand and what they want to hear about. So we have to step up.
Yeah. So, and part of this creating awareness and knowledge, inspiration, is creating this forum too.
Yeah, absolutely. Absolutely, and as I said, this is the 5th time, and we are planning actually together with Vinnova also next time to have another of these summits, and not quite sure where in Sweden, but we have some suggestions somewhere in the south, so maybe that will happen. And the next time, I'm also happy to say that I spoke a little bit with Hans from SciLife Lab, and we hope that we can also have SciLife Lab included in these summits actually, because there are so many synergies and it's also such a fantastic facility actually. So That's what we're looking forward to.
I think we will meet again, or you will meet again.
Yes,
give her an applause for this.
Absolutely. So thank you very much, and see you all.
And I should also say now that, okay, we are now ending the formal session. The informal session will continue. If you want to continue networking, speaking, having small meetings, etc., go back, please, to where we had our lunch, but turn left. And there you can, at self-cost, get some ethanol too, ethanol-based drinks, and non-alcoholic. You have the whole variety.
Just one more thing. I would like to thank you, Maria. As always, you are excellent, so it's a good thing to have you here. Thank you very much for today. Thank you. And also thank you to Tutti and Maja and everyone else who has made this day possible. So big thank and an applause. So let's go to the ethanol.